independent enough to afford therapy, but they are suffering, or they may not be able to convince their parents to, to seek help and to go for therapy. So, do you have a message for them?
Look at, I think there is a still, this is an Alice part question. One part which we discussed earlier, and Mansi also discussed. Still people feel mental health problems means, see, look at, there are two categories, broader categories of mental. One is mild health problems, mild mental health problems. Another is that is called neurotic. Another serious mental health problem, that is called psychotic. The person who is lost a kind of a reality concept, that is detached completely from the world, that is psychotic concept. That he become psychotic, he needs immediate attention. But the people with milder problems, we all get anxiety, we all get stressed, we all get sometimes depressed, but given the family support, friend support, we overcome. So these milder problems can be taken care normally, but still, what I feel, way to go. Even in the school, some of the school now they have started having counselor, but still many school they don't have anybody. So even if they get the problem, where should they go? Whom should they contact? That is the problem. And these are the policy level matters, which need a broader, which can be addressed by policymakers and the government at the larger scale. But now you
Yeah,
find, yes,
and if
Mansi.
you, so if for the students who feel that they can't afford therapy, or for the students who think that their parents won't allow them or to seek help, for them, I think they should create this awareness so that their universities or colleges have facilities provided to them to have a counselor on board on the faculty. And apart from that, we in Rahi as well, we provide pro bono services for students who can't reach out for help. So there are a lot of other organizations as well
Yes,
that
in the
provide
in
help
I
to
cities,
students.
There are a
Yeah.
lot of therapists that provide a sliding scale system
yes,
wherein you
in
can take.
cities these facilities are available. If you have money, you can always approach a trained clinical psychologist. You always can approach a psychiatrist, depending on the nature of the problem. You can approach different kind of professionals trained for the purpose. But still, the structural question remains to be asked is, what about the far-flung areas, rural areas, other areas? So still the majority of the people is still in around the world live in the rural areas. So it's a big area. We don't have enough manpower. We don't have enough infrastructure. So these are the big issues. I think let's see in this century what our decision makers and planners, our policy makers do for us.
Yeah, and
Absolutely.
I
And as
think
Dr.
it
Shamim
will.
said, as Dr.
Yeah.
Shamim said, it's really incredibly important for us to include mental health care into the primary healthcare system, which I think is the only way for us to eradicate the stigma around it. Mansi, would you like to add to that?
Yes, and I think the change will start with you and everyone in this conference. If you raise your voices that yes, we need a therapist or in our organization, we need somebody that we can reach out to for help, that should be made available in your organization. I think that would reduce the problems a lot, so that you have a therapeutic space provided in your college, in your schools as well.
Absolutely. Dr. Shamim, would you like to add?
Yes, I think I added now. See, look at now it's easily available. All those screening tests are available. You can train existing nurses, doctors for very minimum training required, and you can prepare your doctors to at least screen for these mental health issues, and they can take corrective steps at the primary level itself, rather allowing person to become serious, right? To acquire from neurotic, he turns out to be a psychotic, and then it turns out to be psychotic, another problem. And the problem for the psychotic, another is only community-based rehabilitation is the solution. Medical model doesn't work. They go to the hospital, they get normal, they get current shock, and they get some drugs. They start feeling well, and they are discharged from the hospital. They come back to the society again maltreat them again, they are forced to go to the mental hospital. The only solution another is that the community, the people should understand the complexities of the problem, the nature of the problem, and empower the person to deal with the problem. So that
And
is,
I think
and
it's
that is,
really important to understand when the problem is becoming severe. As you said, there are mild symptoms, there are moderate symptoms, and then there are severe symptoms. So, when to identify something while it is still a mild in its mild stage, and stop it from getting that severe where such actions need to be taken. So it's really important also to recognize when something is becoming chronic, when it's becoming problematic, when it gets important to seek professional help. Because as Dr. Shamim and Mansi both said, anxiety, worry, fear, these are things that all of us experience. These are regular emotions, these are human emotions to feel. But when does it become chronic? There's a limit to which you can feel them, right? And after a point, you have to seek professional help. So absolutely. And is there anything else you both would like to add?
and I again would like to emphasize on the sociogenic factors which leads to, suppose a person gets mental health problems, and we know,
Yeah.
and he goes to the hospital, he comes, he has abusing father. So the problem is not with the person, the problem is with the father, but we are treating the person. Did you get my point? So rather
Absolutely.
we should sit down with his father, why is abusing the child. So trying to identify, trying to deal with those sociogenic factors, right? That is, and that can happen only through campaign, through awareness generation, and these young people. I am really happy that the young people have joined and taken to their shoulder this big problem, and something might change.
And
So
Absolutely.
if you feel like you have a certain problem, even if you can't approach a therapist, you can look out for support groups, workshops that
yes.
happen regularly, so that at
Mhm.
least you get a therapeutic experience. And you can the support groups are generally facilitated by a therapist, so you would get to know more about your problem and your how to deal with it in that workshop as well.
Absolutely. I think something that always helps, and I have OCD, so something that's helped me a lot is talking to people who also suffer from the same mental illness, knowing that I'm not alone.
Groups, eh?
As you said, support
Yes,
groups help a lot. And
yes.
I think support groups, and as you said, they're facilitated by therapists. So that is
And sorry,
Yeah,
Saina, to cut you short. Another concept is coming: the people who have overcome the problem. First thing, the
yeah,
labeling is an issue. I think we should done away with the labeling. Labeling do more harm than the good, because suppose I have anxiety disorder. After some time, I become okay, but people still treat me that, no, still I have that problem.
yeah,
So,
they
so
do
that
that.
is that is one problem. We have some
People make it
positive.
their identity.
it
Yes.
People
becomes a
make it their
cardinal trait. It
yeah,
becomes a
Yes.
cardinal trait that people start going by. It becomes the only part of their identity. And I think that's also what leads to the stigma, because
Right.
nobody wants to be identified as an anxious person. Nobody
Right.
wants to be called that. That's why people have this fear of opening up, because they don't want to be called those names. So I think that
I
is an
think yes. Another solution, what I feel, the positive deviant. I hope you understand. Positive deviants are those people who have overcome the problems. Now they are okay. Use them as suppose they had anxiety disorder or depression, and they have overcome. Make a group and let these people talk to other affected people. So these
yeah,
groups can also be a great help to deal with the shortage of the manpower, the cost component. And I think in cities, I was in Delhi for some time, and they have anonymous group. You call
Yeah,
them,
they
you
do
talk
have
to them.
anonymous groups where you can talk to psychologists anonymously, so that
Exactly. So
if sometimes people feel that the judgment would be passed and they don't want to reveal their identities, so there are anonymous groups as well.
mhm.
And what also happens here is that sometimes, even if you overcome your problem, you might see other people suffering, or other ones dealing with some other problem. So rather than passing judgments, ki, hey, I think you have depression or you have anxiety symptoms of that, even though you understand, okay, yeah, they might have those symptoms, you can see that, but I don't think you should pass on judgments saying that to a person who is not aware, so that they would self-diagnose themselves, and that would even worsen the situation. Rather, what you can do in that place is, ki, hey, I think if you ever need help or you want to reach out to a professional, here's the contact a professional only and not a friend.
And I think
So that's
another
what.
thing that needs to be, this is something that needs to be taught in schools. Growing up, we learn how to aid ourselves when we suffer physical injuries, but we don't
Yeah.
learn how to aid ourselves when we suffer from emotional injuries. And that's something that needs to be taught in schools, how to spot a mental illness when it's still in its initial stages, how to seek help, how to aid yourself. My favorite psychologist, Dr. Guy Winch,
Guy Winch.
he's written a book about the science of emotional health and emotional first aid. Just like we treat ourselves for a physical wound, how to aid ourselves when we suffer an emotional wound or injury. So I think this is
Yes.
something that needs to be taught in schools. This needs to become a very normal thing that parents teach their children, because nobody teaches you how to deal with big feelings,
Very true.
how
That's
to.
Yeah, exactly. So in my school, I remember I had workshops where they taught us, I had that written in the books where they taught us how you should apply a band aid, how you should do the first aid. They made us make a first aid kit in schools. But when I, like, now I look back and I realize that nobody ever taught me how should I deal with my emotions. And I think
In
we
fact, I
should
feel like
add that
we
in our
invalidate other
curriculum.
people. Absolutely. And I found my teachers in school invalidating my feelings, telling me that because I'm younger than them, maybe my problems don't qualify as problems. I think that's another thing we need to do away with, is invalidating people's feelings, or telling them that just because you've been through something that you think is worse, their problems are not problems, because everyone feels differently. Problems
Yes.
are not big or small. That's my personal way of looking at it. So I think,
uh,
as you said, yes, Dr. Shamim.
I think the WHO has started some pilot project. It's called
Mhm.
School Health Promoting Models. So this models has been implemented in many places in the world. I think it's true for India also in many schools, and now they are advocating for the replication, scaling up this program where they deal with the bullying, they deal with the corporal punishment, they deal with the humiliation, all those components which might lead to psychological problems. And I was working with one of such project where they had a box in the school, and all the students were told, anybody who has any problem with the teacher, with the student, with the family, if anything wrong happening, just put a slip anonymous in the box, and we used to go and take out those slips, and then try to address, if it is related to the teacher, speak to the teacher, and the student if it related to student. So that's how we used to address. So now these issues are being addressed, but they are not good enough to address. It's a bigger problem. It's a much large, much huge, millions people affected, but we are still addressing very fewer people.
Yeah.
Absolutely.
Okay, please go ahead, Saina. Sorry to interrupt you.
Dr. Shamim and Mansi, I'd like to ask you both, as mental health professionals, what is something, apart from whatever we've just spoken about, what is that one thing that you've seen or you've experienced, about the stigma around mental health that you really want people to know or understand?
Mansi, you will go first, or I
Yeah,
should go first?
I think I'll take this. And
Okay.
so the main problem that I saw that was people feel they don't need help. And even if people feel that they need help and they don't put an effort to reach out to therapists, and they don't have the resources to reach out to them, and again they self-diagnose themselves, which they go out to websites and think, okay, I'll just take up a random quiz to find out what problem I'm dealing with and go take medications for it or do some activities for it rather than going to a professional.
Yeah,
Just to
absolutely. I think it's
okay.
really important to seek reliable resources when it comes to mental health. I think, like today, we have a panel of mental health professionals. So this is a safe space for someone to, clear their doubts or ask questions. But the internet does not always tell you the truth. So I think
Yeah.
that's a great point, Mansi. Yes, Dr. Shamim, please go ahead.
Now, I also wanted to talk to about the barriers to seek treatment or health services. There are hundreds of barriers, and it differs from culture to the culture, culture to culture. And in Indian context, there are many barriers. Suppose I have mental health problem. If I seek go to the psychiatrist, people will say, no, this guy is pagal hai. So there is some problem. No, again that stigma comes in, which is one of the major barrier. So money is another barrier. A lack of professionals, mental health professional, another barrier, right? So we need to deal these barriers in a very systematic manner, be it policy making at the larger level, at the individual level. As you said, you should know the reliable source, the reliable trained professional. It should not be a quack cheating people. So there are many barriers. This is very complex issue, but we need to begin from somewhere,
We
one by
need to
one by one.
begin with
Uh,
validating emotions.
I'm so sorry to cut you out, Mansi. We're running short of
Mhm.
time, and there are a few questions that we have in the chat that I'd like to address. We have a
Mhm.
question from Vandit Jain, and he's asking us how to approach a therapist. How can
Yeah.
one approach a therapist for the first time?
So, as I said, even if you have no therapeutic experience or you don't know how to reach out to a professional, you can join workshops, you can join support groups so that you get an idea about how a therapist and how therapy works. And even if you can approach a psychiatrist or a psychologist directly, and even we at Rahi have 12 psychologists on board, so you can contact us as well, and we would provide you with all the services that you need.
Another
Um,
thing, Rohit, I would like to say, you see, these mental health problems are not very, and I suppose, it's not very pill based. You get a doctor give you injection or pill, then you become okay. So sometime it requires little more patience. It takes time to heal with to get over with your mental health problems, right? So it takes time. Patience is patience and perseverance is these two components are very important when you go to any therapist. Immediate results are not possible because the causation of mental health are not straightforward, right? Here
yeah,
it's not one bacteria causing a disease. Here there are multiple factors producing a mental health problems, right? So those multiple factors I already told you, they may be biogenic, they may be sociogenic, they may be psychogenic, right? So it's not easy for the therapist also to give you very instant relief,
Absolutely.
something.
We study in psychology, and I'm a psychology student myself, and we study about
Good.
how mental health is a product of nature and nurture. So it's your
All right.
environment as well as
Mhm.
your genetics, as well as the social factors. It's
Right.
influenced by so many things. So
Exactly. Mhm.
absolutely, I agree with you on that, Dr. Shamim. We have a few more questions about how to deal with your own emotions. We have a lot of sessions lined up. And those sessions will be telling you, we have mental health professionals who will be telling you how to deal with your own emotions. And so we're running out of time, so I would like to thank you both. for speaking at our conference and for all of your wonderful input. So thank you so much, Mansi and Dr. Shamim. This has been a
Thank you very
very
much.
Thank you so much, Saina, Sayed, and Suchata
Thank
for
you very
having
much.
me.
thank you.
Thank you,
Bye.
Saina, for moderating it. It's lovely. Thank you, Shamim and Mansi. Lovely discussion. I know there's so much more that we need to discuss. We couldn't put everything in here. We had to leave some of the questions, but we'll come back to it again for another session. But thank you so much.
Yes, for sure.
Moving on, we have Mranmai, who is joining us today, and Bianca, who is going to introduce Mranmai. So take it away, Bianca.
Our
Hello.
next speaker for today is Mirunmai Advakar, who's going to be discussing the different types of therapies such as CBT, BT, and more. Mirunmai is a senior consultant psychologist at Inner Arm who has worked extensively with clients struggling with grief, trauma, cancer, and their caregivers and children. And in the last 10 minutes, we're going to have a small Q&A session with her. So, Mirunmai, how are you doing today?
I'm doing good. I hope everyone here is doing good. Just let me know if I'm audible, yeah, and if people can hear me.
Yes, you are. So, without
Yeah.
further ado, Mirunmai, the floor is
Okay.
yours.
Yeah. Let me share the screen, and please again give me a heads up if you guys can see the screen. Is the screen visible?
Yes, it is.
Great, great. So today I'm going to be talking about different kinds of therapies, and although it's a vast, huge topic, it's not possible to cover everything today. But what I want to do, or what my goal is, to just give a glimpse of what all exists out there. This is by no means an exhaustive list of therapies. So if you guys have any kind of questions, clarifications, please do ask away, and let's start. So before we begin, I just want to give this a disclaimer that whatever I'm going to be speaking is it can be considered as a general guideline, and it is a supplement. It can be considered as a supplement for your personal self improvement, right? This is not intended to be a substitute or to replace the treatment, the diagnosis, or the advice from any kind of qualified licensed mental health professional. And this goes without saying that please always consult a qualified and a licensed clinical professional, be it for diagnosis, be it for treatment, right? Self diagnosis is a big no no, so please don't fall into that trap. And let's get started. I just want to put these statistics out first before we move to the therapy part. Why are we talking about therapies, and how does this tie up in the bigger picture, right? So in the last 20 years, psychosocial problems in children, among children, have gone from 7% to 18%. We all know that 4 in 20 people are diagnosed with depression, with clinical depression. And in adolescents, concerns such as anxiety, mood, attention, and behavior disorders are on the rise. And especially in the last 1 year, all these things have been exacerbated. Children, adolescents who have not faced any of this earlier are also struggling with this, as are adults. And suicide is the third leading cause of death in older adolescents between the age groups of 15 and 19. And, like previous speakers have said, the causes are numerous. It's a complex case, it's not as straightforward as we would like it to believe. So, how does psychotherapy play a part in any of this? What is psychotherapy, right? We all have heard these memes. We've all seen these memes, heard it from other people. That I can always go and talk to a friend. Why do I need to go and see a therapist? Which is true. You can always go and talk to a friend, but why do we need therapy? Because therapy is a conversation, it's talk therapy between someone who makes a space for you that is safe, that is non-judgmental, that is unconditional, right? And it is an interaction with the child, with the adolescent, with the adult, or in also some situations with the family. The whole point of therapy is to understand your problems, is to resolve your problems as best as possible, to modify behaviors, to modify thoughts, to accept your feelings, to accept your emotions. And all of this then translates into some sort of a positive change in life. The way I see therapy working is first to create insight. What is that I'm going through? And then how do I use this insight to bring about change? So, this is again in a nutshell about therapy. Let's move on to some types of therapies, and like I said, this is not an exhaustive list, but these are the few things that I would like to touch upon today. These sort of make the foundation for the newer therapies that have come along. So let's get into it. First, psychodynamic therapy. Everything begins with Freud, and psychodynamic has its origin in the Freudian psychoanalysis, the classical psychoanalysis. Although no one practices it as Freud had intended to, people have modified it, and the elements, the essence is retained, but maybe the approach and the therapeutic intervention is then different. What is psychodynamic therapy, right? What does it mean? It means that the therapist will consider your emotional distress as a result of something that is ongoing for you internally. So there is an internal psychic conflict, and the manifestation of it is in terms of emotional distress. Here, what happens with an individual is that if there are emotions that are overwhelming, disturbing, you keep them out of awareness on purpose. It serves a self preservation mechanism. So the therapist use strategies like working through the transference, uses some sort of dream analysis, free association, and so on, to bring all of these thoughts, these unconscious motives into the awareness, and then work with it. So when we attempt to cope with the psychic distress, the symptoms invariably go down. And again, like I said, the symptom is a manifestation of something that is happening internally, right? So you're not just treating the symptom, but you're also treating what has happened with you at a psychic level. As goes with all the therapists, it's a non-judgmental and understanding environment, and in the process you also realize that you need to label some of the emotions that are expressed to better understand that. One thing that has come up consistently in research is that children often worry about burdening their parents, burdening their caregivers with strong feelings, right? And for them, it is sort of reassuring to know that a therapist is someone who can take that load, and not become distressed by it, right? Or who can take that load and not say things like, oh, but you're too young, you shouldn't be feeling this way, or whatever. So psychodynamic therapy does work well with children as well. Of course, with older children and with younger children, there are just different mechanisms as to how you work with them in a psychodynamic therapeutic approach. Moving on to something that has become a very common term used, especially in the last 1 year, is cognitive behavioral therapy. And what is that? So it involves examining my distorted patterns of thinking, my cognitive errors. It also teaches me how my thoughts, feelings, and behavior interact with each other, right? And how this then influences my actions. So, as a part of the therapeutic process, I learned to identify these harmful thought patterns, or these maladaptive thought patterns, and then with the help of a therapist, I attempt to replace with this something more appropriate. And when I change my thought pattern, it also translates into change in my feelings, which invariably will change how I act in a certain situation. So some common strategies that we use in CBT is tolerating painful emotions, cognitive restructuring, where you ask questions like, whatever you're thinking, is there evidence to it? Is it 100% true? Is there an alternative explanation for this? So forth and so on. Role play also plays a big chunk in this, because when you're role playing, you're trying to understand what the obstacles could be, and if there is, how can I get around those obstacles. CBT has gone through rigorous research methodologies to prove that it is effective in treating a large chunk of conditions, including depression, anxiety, eating behavior, behavioral concerns. But it has also proved very beneficial in trauma as well, right? There's a whole separate module for people who are dealing with chronic pain, and how CBT can be useful there. Let's move on to something that has emerged from CBT, which is mindfulness based cognitive therapy. Right. What we are trying to do here is we are trying to take some elements from CBT and some elements from mindfulness meditation. The mindfulness meditation here looks a lot what Buddhist philosophy teaches us. So the whole idea is to change my relationship with the thoughts and feelings that I find overwhelming or distressing. right? So I'm not trying to change anything here. I'm just trying to say, okay, this is what I'm feeling, this is what I'm going through. Let me sit with it and let me try to accept it as it is, right? So here your actions are purposeful. You're making an effort to bring those thoughts and feelings into awareness. You're very much into the present moment. You're not running into your future, or you're not going back to your past, but you're very much grounded in the present moment. And of course, there's a non-judgmental stance towards yourself and towards also your thoughts. So if I'm having this thought that, oh, I would want to go and kill someone, or something like that, I'm not judging myself for having such a vile thought, but I'm accepting it ki this is what is happening. A very It's proved to be a very powerful tool in prevention, of a relapse in depression and also the after effects of trauma. So it almost works like a barrier, like a buffer between relapse. Some obvious strategies that we use in mindfulness, cognitive behavior therapy, is body scan exercise. We're just aware where you're holding the tension in your body. How do you go into a state of tension, and then how you experience that state of relaxation. A very famous exercise in mindfulness CBT is eating a raisin with awareness, right? And we do variations with this. We do eating a chocolate with awareness. So you're just really soaking yourself into the moment, how the wrapper feels, how it makes that crunching noise when you put the chocolate or the raisin in your mouth. How does it feel? How is the texture? Is it hard? Is it soft? Does it melt in your mouth? So on and so forth, right? Mindful movement. So there is a whole space with meditation app, Headspace. I know for sure because I've used it in past. It offers walking meditation. So whilst you're walking, you are sort of experiencing a meditative state. And how can you be more than aware and be in the present moment? Thoughts as cloud. This is something that I encourage my clients to do as well. The reason why we spiral, especially with anxiety, is because we think that we have to chase each and every thought, right? But when you think of a thought as a cloud, clouds are not static. They don't stay in one place. They move. Right? They float along. So similarly, your thoughts should be moving from one place to other, and you should not make an attempt to catch it, but just observe it like you would observe clouds in the sky. I'm going to move on to my favorite bit of this, the humanistic therapies. Humanistic therapies are non-directive, which means that the client has gets a say in where they want to take the session, right? So you are not directing the therapy in any way. The client has the power to do that. So humanistic therapy comes from a place where there is a lot of responsibility, onus for change, for the client, right? As a therapist, all you're doing is you're being a counselor, you're being a guide, you're doing the hand holding for them. But at the end of the day, it's them who has to uh, take the responsibility, accountability, and change. Humanistic therapies also acknowledge that people have freedom, and while they're free to do things, free to think, and free to say, there is also a responsibility that comes with it. And both of these things are in their control. The whole idea of humanistic therapies come from a definition, of WHO, that health is not the absence of a disease, but you're trying to reach your fullest potential. So the goal here is to increase self-awareness and to increase self-acceptance, right? Self-awareness does not translate into clarity or acceptance, but you have to work towards both. I'm quickly going to just name the three therapies that have gained popularity here. One is the client-centered therapy by Rogers, and the belief is that the client who comes in with the problems, with concerns, with depression, anxiety, they have it in them to heal themselves. They have the capacity to make their situation better. It's on them to sort of take control, to take charge of their lives, right? As a therapist, you are only directing them. You're only reflecting back to what they have said. You're only empathizing with them. And when you create such a safe space for them, when you create an environment where they can be unabashedly, non-filter kind of a self, it gives them power to change, because then nothing is suppressed, nothing is repressed, nothing is ignored or neglected. Gestalt therapy is a bit different than this, because there's a lot of emphasis in how your body and mind works, right? So what you're experiencing in your mind is also experienced in your body, and you use your body as a sort of a signal to understand what is happening with you internally. So for instance, if I have a headache, and if I'm feeling stressful, then probably the two things are connected. Maybe I carry my stress in my shoulders, so I need to sit with it, and I need to really focus on my shoulders where I'm carrying the stress. There are a lot of exercises here, and the exercises here are a lot experiential, right? The common being empty chair technique, where there are literally two empty chairs, and you have these two voices in your head, and you sit in one chair and you let that one voice flow, and then you sit in the other chair and you let the other voice flow. By doing this, you're bringing both of them into your awareness, and then you're better able to understand that both of the things can coexist, or if one thing needs to be let go of. Existential therapy is something that I personally have a huge stake in. And what existential therapy does is that it understands that that the whole purpose, the whole point of life is to do something, right, or is to be something. So it attempts to cope with issues of meaninglessness, isolation, death anxiety, and freedom. Meaninglessness, people come in with a lot of questions, who am I, what am I doing here, is this even worth it, what's the point of it all? The questions of existentialism or existential threat have become so real in last 1 year. But it also deals with isolation. The idea that even though you are surrounded by people, you have a partner who is absolutely brilliant and loving and caring, or you have parents and family who loves you to death, there are going to be moments when you're going to be on your own, when you're going to feel that loneliness. Like they say, we are born on our own and we die on our own, right? So how do we come to terms with that, and how do we learn to then deal with that isolation in a healthier manner? Death anxiety is sort of bringing the awareness of death into the room and speaking about it. We are all aware of our morality, but we don't make an effort to acknowledge it. And when you start acknowledging your morality, that you have finite time and finite possibilities exist for you, you start to make decisions based on what's important, and say not on what is expected of you. And of course, all of this ties with freedom, that I have to work in my boundaries, I have to work in my limitations. But is there a chance, is there a possibility that I can probably create my own structure? Is there a possibility that I can stretch those boundaries? That's what it's all about, again, in a nutshell. Narrative therapy is something that works brilliantly with the population, with the population that is children or adolescents, but also young adults extensively. Why I'm talking about this is because storytelling is one of the ways in which we express ourselves. Storytelling is the way in which we give meaning to what has happened, right? Even when you're narrating something that has happened at work, or that is happening in your family, you are storytelling in a way. And when a person comes into therapy, when you link these major events, right, in a chronological order, you sort of start making sense of how all of these stories have shaped that person, how the person got here, right? And what narrative therapy does extensively is looking beyond those few events, and looking at the periphery, looking at what is happening around those events, and just making the client comfortable that this is just not your story. Your story are also these smaller dots on your canvas. Uh, and when the client is able to do that, the client is able to rewrite or restructure whatever has happened with them. So, for instance, when a client comes with a problem structure, that everything in life is problematic, narrative therapy enables that person to look beyond those problem stories and look what has enabled them to come to this place that they are. interpersonal therapy. The goal is to focus on the client's interpersonal relationship. All of us agree that if there is something wrong with a significant relationship in our life, is going to impact us. So what we do in IPT is basically understand what it is that is going wrong in a significant relationship, and how we can change it to sort of then have a ripple effect back and then reduce our distress. We try to identify individual problems in terms of interpersonal relationships, and then the interpersonal relationship is then addressed. This model was specifically developed for depression, but now it's used to treat a wide variety of clinical conditions. So one thing that we do in IPT is do a communication analysis, right? Where is it that the communication is sort of going wrong, and what can
Hi,
we do to.
Mrinmai. Sorry to interrupt. While you made some amazing points so far, we're running out of time and we'd like to ask you a few
I just
questions.
have one last
Yeah,
bit to
sure.
address, and I'm done. Like that's it.
Yep,
Just give me
continue.
1 minute. Yeah. Yeah, art-based therapy. This is something that works amazingly. I have had a chance to do a workshop on it, and personally, and also in the group, I could see that how when you make use of art or any creative process, it improves a person's well-being, overall well-being, right? But it's just not enough that you make an art, but you also reflect on it, right? You also reflect on what has happened with the art product, what was your process while you were doing that art. It increases self-awareness immensely. It helps to sort of put forth what is happening with me without the need for any verbalizations, or without or as limited verbalization as it can be. And with children, with adolescents, it's a huge way to break that barrier. And like I said, although art is for everyone, it works brilliantly with children. They're a lot more expressive, and sometimes they don't have the vocabulary, they don't have the language to say what is happening. So play therapy, art therapy is something that works wonders with them. And I think I am at the end, so I'm just quickly going to stop my screen share, and we can go ahead with the questions.
So first of all, that was an amazing panel. So we have a few questions we wanted to ask you. So with the
Sure.
rising cases worldwide due to this pandemic, how do you think this has affected people's access to therapy?
Hmm. I think there are two ways to look at this. One is because everything went online, because everything went on Zoom, it made people able to approach therapists, psychiatrists, counselors that are not just in their geographical area, right? So I could get on a call with a counselor, with my therapist in Bangalore, and have a session. So that's a positive thing. Uh, Even the awareness has increased. So I, especially last in the beginning of the last year, I could see a lot of Excel sheets that were circulated around with a list of people who are offering pro bono services, people who are offering sliding scales. So there is just a lot of awareness also in terms of who is doing what. But what I see it has also done is that people who come from a place, a family environment that is toxic, maybe there's violence in the house, maybe there's just no physical space, right? You can't always have the luxury of having your own room and talking on a phone. For them, seeking therapy and then following up with therapy became a huge barrier, right? So they had to go on their terrace, find space in the parking lots, so on and so forth, which is not ideal. But we all have to do with what we can. So I see the whole thing in two through two lens.
Yes. So one question from the YouTube live stream asks, how do you deal with self-harm?
So with self harm, and that is something that I am sure that I haven't mentioned in the presentation, is there are separate modules with self harm, and DBT, dialectal behavior therapy, is something that has proved very efficient in reducing self harm. Why is that? Because DBT teaches skills like emotion regulation, right? How am I regulating my emotions with the context of what is happening in my life? How do I learn to tolerate distressing emotions, right? How do I learn to tolerate that wave of pain or that anxiety? How do I better learn to tolerate uncertainty? And then I sort of learn to also have some other measures in the place, uh, with which prevents the self harm from happening. So there are various there's a whole module in DBT, and the I think the manual is available online, so a lot of people can go and approach it. A simple thing we could start with, is how can you distract yourself when you get self harm thoughts, right?
And we have a question from Mansha. How can we reduce prejudice towards someone who wants to seek therapy?
Hmm. Um, I think that we all need to start acknowledging that it could happen to anyone. When we speak about mental illness, when we speak about mental disorders, it's just not restricted to clinical depression, anxiety, bipolar, or schizophrenia. We all undergo situations in life that can hamper our mental health, that can make us feel stressful, and that can have an impact on the various aspects in our life, right? So when we start acknowledging that it could happen, it could also happen to me, and we also start to realize if it can happen to me, it can also happen to the other people, right? Having said that, again, platforms like this that talk about it, and I would also encourage people who have gone through something like this to come and share their stories. uh, what it does, it also tells people that that someone that I'm going through this, there's treatment available, this works for me, which will also mean that it will work for you, right? So be vocal about your struggles. There's no shame in having struggle. Everyone is going through something or the other. Yeah, and again, it all comes back to education and awareness. If you don't know something, ask that person, ask the doctors with anything, go to proper reliable resources.
So, regarding the education and awareness that you mentioned before, so far we have seen the rise of portrayal of mental health and mental illness in the media and popular culture. So, how do you think this has affected people's views towards therapy?
Um, I think it's a very interesting question because I see some movie shows depicting it brilliantly, and I shows just as much portraying it horribly. Like, I know I saw this video very recently. Someone had commented about the second season of Family Man 2 or whatever it is, how they have not portrayed therapy accurately or as accurately as it can be, right? But I also know that there are shows out there in popular media where they get some bits right. I think at the end of the day, what all of it does is that it at least puts therapy or any kind of a mental health concern or mental health awareness education in the mainstream, right? Even if I know that it's not being portrayed right, at least it's out there. At least I know people like my parents' generation, they'll be able to see it. They may not understand it completely, but at least it's there out in the open, right? So it is, I would like, and I think I'm being too optimistic here, but I would take it as just like a initiation of a bigger conversation, of a bigger dialogue.
Yes, so it's good that people are raising awareness towards it. So it help to reduce that stigma, which is what we want to achieve. So Anish asked, how does CBT help a person undergoing bipolar disorder?
Oh, that's a very specific question. I think for that you have to evaluate the person. You have to understand the severity. The first line of treatment for bipolar is always medications, and once the person has stabilized, then you can work towards rehabilitation. And how does CBT work? CBT works in terms of the shame, guilt that the person is feeling. A lot of people who have experienced bipolar disorder do report this, right? That they do things when they're out of control, and then there's a lot of shame and guilt associated with it. CBT also has a huge component of psychoeducation. Just psychoeducating about the illness, signs out to watch out for, what can they do when they feel like things are just beginning to get out of control, right? How do we maintain a routine? How do we maintain our sleeping habits? All of these comes there's a whole different book manual for CBT pertaining to treating bipolar disorder. Yeah, but the first line of treatment will always be medications.
So going back to the topic of media and popular culture, there have been shows such as 13 Reasons Why, which have talked about serious topics such as suicide and self-harm. So while it has brought on the conversation about how we should react towards it, it's also been somewhat problematic due towards its a glamorization of suicide. So what is your opinion on it?
Well, full disclaimer, I haven't seen the show completely. For some reason, I just couldn't stand it. But what I would say here is that, of course, it is problematic, and I have read enough to know that it is problematic. People have not been happy with how they have portrayed things because, like you said, it's glorification and it's also normalizing this behavior to an extent, right? Having said that, it is also an opportunity to talk about these things, right? When you see that there is something that's not done right, what you do is you basically say that, okay, hey, this is not how it should be. This you need to also look at these things, right? Again, like I said, this is all like a starting point for a bigger conversation. And considering this, I don't think it is going to be possible to make a show that involves therapy, mental health, in just 100% correctly, because the experience of it is so different for different people, right? So I may relate to something from it, but the other person may not. Other person may find that this is not what depression looked like for me, or this is not how my anxiety looks like, right? So the experiences of how it is felt is also very different, and we need to sort of take those things into consideration. But I would take it as a starting point for a bigger conversation.
Yes, that was very insightful. So, usually there are some people who usually downplay when somebody is going through something. Like, for example, when you have like a serious, mental health issues, people usually think you're acting like you want it for attention. So, what
Yeah.
do people do in that case?
If you're thinking that someone is having a mental health concern and you think that the person is doing so acting up for attention, maybe a good place to start is to ask, why is that person seeking attention? Right? What is it that is making them seek attention? And if you have to think about logically, if I'm seeking attention, and if I'm not going through anything, why would I portray myself as if I'm going through depression or anxiety or anything else, right? uh, I would probably do something on the other end of the spectrum to get that attention. So that could be a good starting point. The second thing I would want to reinforce here is have a conversation with that person. Even if you think that that is what the person is doing, ask them, what is it that is happening with them. Are there any obvious distress that they're going through? Are they going through a divorce? Are they going through unemployment crisis? What is happening with them? And if you have enough evidence, then maybe you need to check your own prejudices. Maybe you need to check your own biases, and then take things forward from there.
Okay, Bianca seems to have frozen out there, so I'll just jump in. Bianca, you're back. Go ahead.
I'm so
You
sorry
can.
about that.
No
Please
issues.
excuse
No
me.
issues.
So now we have seen the rise of like support groups, and we
Hmm.
usually talk about our issues and with like-minded people who have gone through the same thing as us. So how do you think that helps to reduce the stigma towards reaching out for therapy?
I think it's a wonderful that has the thing that has happened. For one reason that I know I can personally relate to is I know that someone else out there is also going through the same thing, which means that what I'm experiencing is not abnormal. What I'm going through is not something that I need to be ashamed of, or something that it's not a reflection of myself or my identity. It's not a weakness, right? So that is what these support groups, these peer groups does. And there's also, I have seen, there's also a lot of camaraderie amongst people, the people, because they know that what they have gone through is something that's not a pleasant experience, because they also realize the barriers towards seeking treatment. People are quick, or at least people are forthcoming with any kind of help that they can offer. So if I'm putting on it on a group that I need to go and see a therapist, I'm sure that people are going to come up with a list and recommendations, right? It's a huge support network. It's a huge support, not just in terms of where I can talk about things and vent out about things, but also when I'm looking for practical help. What I have also seen happening is when I see someone else seeking therapy, when I see someone else going to a psychiatrist and taking medicines regularly, it assures me that, what, this is something that I can do as well. This is something that maybe I should also consider doing, right? So it just builds up that confidence. It just normalizes taking treatment, going to a therapist, going to a psychiatrist. So support groups of any kind, peer groups of any kind are doing a huge job in that perspective.
That was great. So we have one final question for you.
Sure.
So, what advice would you give someone who wants to go to therapy but is hesitant to do so?
I think I would ask the person, what is it that they are hesitant about? What is it about seeking therapy that they're not comfortable with? Where are these anxieties, insecurities coming from? What are they afraid of? And if they're able to at least come up with a few pointers, right? Maybe it's about confidentiality. Maybe it's about, I don't know if I need therapy. Maybe it's about, I don't know what graves I will dig up once I go to therapy, right? So once you have an insight about whatever it is that is holding you back, talk to someone. Talk to someone, maybe on a formal basis, maybe on an informal basis, and get those doubts cleared, right? If you're going to keep Googling about this, Google will give you alternatives. It is not going to give you a decision. So you have to make a decision to, at the end of the day, see someone. Going into therapy, ask people for their qualification, ask people for their experience, ask people what they're comfortable, what kind of population they're comfortable dealing with, right? How they think they can help me as a client. So once you start clearing these doubts, clearing these these obstacles, maybe you will be better. I don't know, maybe you'll be better approachable, or you'll think therapy in more approachable terms. But yeah, I think the first thing I would tell them is, why are you hesitating? If you know that you need to go see someone, what is holding you back?
Oh, looks like we have one more question if you're fine with that. So
Sure,
the
sure.
members of the LGBTQ plus community are still ashamed and are called very derogative names in today's world. So how do we deal with this when your own peers and family do this to you when they don't want to help and understand you?
It so happened that I attended a workshop yesterday, which was directed at how do we use DBT, dialectal behavioral therapy, with this population, especially with this population, right? And one thing that came up constantly is, how do you find acceptance, self acceptance in a world that refuses to accept you? And it's a complicated question. There's no easy answer to it. Like I said, each one of the member of a queer community has very different experience. But again, I think I would start by saying that find your people, find your tribe, build a social support network that works for you. It could look like other people in the similar support group. It could look like your friends. It could look like an extended cousin who is okay with, who is accepting of it as well, right? So start there, and reach out to a mental health professional, because I have seen it in my professional experience, in my personal experience, how this stigma and how just the kind of language that we use around such people has such a devastating impact. And when you speak about these things in therapy, I'm not saying it's going to change the world, but it's going to make you better able to reflect on those experiences, and make peace with it eventually, right? It's a process. It never works. It never goes from A to B in a straight line.
So, thank you for that. I think that concludes the end of this panel and this session. Thank you so much, Miranmai, for this session. It was very informative and insightful. And stay tuned for the next panel.
Thank you so much for having me. It was wonderful. Thank you everyone involved in the back end to organ who have been organizing this. The process has been just seamless and smooth. So thank you so much, and have a good day, everyone.
Thank you, Mrinmay. That was really nice. In fact, that's a lot of questions answered, a lot of questions that came through actually. So thank you for taking all of those. And there might be an odd question or two that may still be in the chat. So if you could
Hmm.
possibly take that, it would be wonderful. There is, I think, one more question that has come in, but I'm going to let the next bit start and let you just take that question in the chat. So thanks
Sure,
so
sure.
much. Thank you.
Thank
And
you.
I'm just going to now bring on Syed and Arna for the next session. The topic is the science of happiness, and there couldn't be anyone better than my co-founder Syed Jamal to talk about this. This is what we talk with students every day at colleges. So Syed, please, the floor is yours, and Arnav, over to you.
Hello, everybody. So, Syed is going to be talking about the science of happiness. Syed is the co-founder of Collegy, who mentors students for Collegy projects. He also works for 176.vc, one of the largest entrepreneur networks in the US, and Bridge for Billions to mentor entrepreneurs. He studied international affairs at Ohio University as a Ford Fellow. Syed, you can start.
Thank you, Arnav, and thank you, Suchita. Yes, I could not emphasize more how much time and energy we spend in this topic, the science of happiness, the idea of happiness, and why it's so important for us to be happiness. I think, when you study this whole world of productivity, you hear a lot about use this app, use that app, 5 a.m. club, and whatnot. But the reality is that if you're happy, and if you are able to do some of the things that we'll talk here, your productivity goes up, your relationships become better, your performance becomes better. And at the end of the day, our goal here at college is to see our young people performing at their peak without getting depressed, without stressing out. So the topic here is the science of happiness and your everyday to-do list for mental health. And I really want to emphasize that part, your everyday to-do list for mental health. It's very important to remember the two key words here: one, every day, and to-do list. So it's something that you have full control over. Happiness is caused. And I want to talk a little bit about what does it mean. What else is caused in our lives? And when things are caused, what do we do? How much control do we have? When earthquake happens, do we have a control over that? Don't. It is caused. There is a reason why it happens, but it's so much outside of our control. And you can think about it. What else happens that outside of your control? My family was pretty much outside. I was born into a family outside of my control. I was born into a country outside of my country. Most of the time, the political party, the social structures, culture, communication, language, a lot of these things that we're born into is outside of our control. They're caused, but it's not within our control to shape the happenings of those events. Happiness, thankfully, is not one of them. And this session is just to prove that point. And I hope that when you go home today after the conference, you remember this, that happiness is something that is absolutely within your control. And a good analogy here is that of a car. So if you're driving a car, you have a steering wheel, you have the brakes, you can put your foot on the accelerator, car will go fast, you can reverse, you can do a lot with the car. So it's well within your control. And if you control it well, you are safe and people around you are safe. But at the same time, you also have to watch out for other people. So you might be an absolutely safe driver. Your car could be absolutely safe car, well serviced, totally safe. But someone else might be driving in a bad way. So someone else is breaking the rule, and that could risk you. But if you think about it, when we think of the safety, what do we focus on? When somebody asks me, hey, are you a safe driver? What is my response? Before I answer that question, I say, yes, I am a safe driver because I put my belt on, I drive a safe car, I follow the traffic rule. I don't say, oh, I am safe, but you know what? I don't know about others. We don't really focus on what other people are doing. We just hope that they drive around safely as well, but we focus mostly on us. And that's what happiness is. If you focus on your own life and take control of it, you can create happiness in your life. And then you just have to watch out, just like bad drivers, you just have to watch out for certain people and certain situations and certain environment. Just don't go there. Uh, because if you go there and if you let them engage, there will be an accident. And in that accident, you will lose happiness. So what I want to emphasize is that it's absolutely within your control. You can do it step by step. And in the next few slides, I'll talk about those steps um, to become happy. And when you are happy, it just changes the entire environment you're in. You have no idea when your mom sees you happy. You have no idea when your dad sees you happy. Your friend is so contagious. And world would be such a beautiful place if we all learn being happy as a skill. Don't think that happiness is some kind of a fuzzy idea and you need a lot of materialistic possessions. It's really something that's right within you. You can control it just like a car. You open the door, you sit on a car, you put a seat belt, you accelerate, you put a reverse gear, you go forward, you turn left. You do everything in the car, and that results in what we know as a safe driving. So how is that possible? Why am I comparing happiness with driving? Because of these reasons. Now, for something to cause, uh, there is something needs to happen. Your car will not start. You have to put the key in and turn it so it starts and it works. With happiness, there are certain chemicals in our body. They kick in and they cause happiness. And I will briefly talk about those chemicals and then some of the ways in which um, you can create those chemicals in your body, and they will directly result in some of the happy moments in your life. And I think most of you would have already experienced it. So let's go to the next slide. So one is called dopamine. It's called the reward chemical. What happens now? Imagine what happens when you eat food and you're hungry and you've been, let's say you've gone to school and you've come back, you're hungry, you eat food. What happens just before you have eaten the food? And what happened immediately after eating the food? A lot of people are very angsty, they're frustrated because they're hungry. You don't want to argue with somebody who's hungry. People get violent when they're hungry. And it's a normal thing. That's how our body is designed. If you are hungry and you don't have food, you're gonna lose. Especially when people are fasting. If you notice, if you're fasting in the beginning, maybe it's all right because you've eaten in the morning or you've just eaten something and your fast has just begun. But 8-9 hours into fasting, notice people lose control. They get very irritated. So when you reward yourself with food, this chemical kicks into your body. It's called dopamine, and it rewards you, and that reward leads to happiness. The second bit is when you achieve a goal. So anytime you do something that you wanted to do and you don't delay, or even if something that has been, you have been delaying it and you do it, even if it's a small little thing, you finish your assignment, you post a blog post. In our case, with Ecology, when people do projects, they have very specific goals. These are weekly goals. Like all of you who are doing this conference, you are responsible for doing this conference. When this conference gets over, a piece of dopamine will kick inside you because you started a project and you have finished it. You have achieved a goal. So achieving goals makes you happy. So try to achieve goals, small goals. Promise yourself you'll go for a walk and go for the walk. Promise yourself you'll write a blog post and write the blog post. Promise yourself that you will make a call to some uncle or some auntie of yours, or you'll go out and meet your cousin. Set goals and achieve them, even if these are very small goals, because as you achieve them, a reaction is happening in your body. That dopamine will let you, it will give you the moment of happiness. Sleeping well. I mean, sleep, I cannot emphasize more. Suchit and I often talk about sleep because we don't get to sleep very much with this whole work that we do all the time. But sleep is such an important part. Just sleep well. Sleep 7, 8 hours a day and sleep comfortably. Turn off your light. Don't use mobile phone just before you're going to sleep. 2 hours, 1 hour before you enter the bedroom. Read before you sleep. Listen to something soothing. Just sleeping will create a chemical in your body and you will become happy. uh, Bathing, take a good bath. That create dopamine in your body, and when you take a good bath, it makes you happy. You don't realize it because when you're taking a bath, you're lost somewhere and you want to quickly do it. You don't really give it enough time. But take 2 baths, 3 baths, whatever time you have. But remember, this is going to cause you happiness. These little acts create a chemical in your body that builds happiness. The The other chemical is oxytocin. This is called a love chemical. I mean, what happens when you socialize with your friends? How many of you go and socialize with your friends and families and neighbor and mom and dad and relative and don't feel happy? Not possible. For humans, it's just not possible. I am making this presentation, but if I have two of my cousins here and we sit down and chit chat, I'm just gonna be happy because that's how my body is designed. And it's not just the design part, it's also that part of the design. When I'm talking to people I like, my friend, my mom, my dad, my uncle, auntie, friend who I enjoy talking with, something happens in my body. And that something is this chemical, oxytocin. It gets created. So socialize with friends, take time out, hang out with the people that you like and talk to them. Helping people, that second part, when you help people, that chemical gets created in your body. Again, I'll give you the example of Cology. All Cology projects require you to make an impact. How can you make an impact without helping? I mean, just think of all the impact in the world. Can there ever be an impact which doesn't help somebody? It's just not possible. We want you to make an impact. We emphasize a lot. You partner, the task force that you're working with, variety of nonprofit organizations. At the end of the day, you're trying to help. You're trying to help the environment. You're trying to help somebody. You're trying to help the situation. You are in that mode of helping. And when you do that, this chemical get created in your body and it gives you the feeling of happiness. You become happy. It's not just the feeling or perception. It's real. When you do this, you go out, you smile more, you laugh more. People will look at you and say, why you look so happy today? You will become happy. uh, Animals, petting animals, that very specific act, having a dog, having a cat, or just any animal, just spending time with animals makes you happy. And there are in my neighborhood, I have one of my neighbors, she has 2 cats and they're therapy cats. They have these skills, cats, and she travels all over the US with those 2 cats, and she goes to the hospital, and those 2 cats provide therapy to people who are unwell for very long or who have terminal illness. And these cats are basically, because animals are proven to have uh, this effect, very soothing effect. And the specific reason is because they create this chemical in human body. And finally, for this particular chemical, physical touch makes you happy. You go hug your mom and see what happens. Go hug your cousin, shake hand. In many cultures, for example, people hug a lot, or in certain culture, kissing is a very romantic thing. It's just restricted to romance and romantic. But in other culture, it's not. Like, for example, Middle Eastern culture, people, men come and they hug and they kiss. The point here is that physical, human, when they touch each other, The human touch creates this chemical. It's very unique to human touch. You can't go and touch your home and expect this chemical to get created in your body. You may have the fanciest car in the world, but if you go and touch that car, this chemical is not going to get. It has to do with human touch. That's why, as culture, we hug, we kiss, we shake hand, and we do. Just think about the culture, how much physical touch plays a role in culture across the world. Why is it so? Because of this one particular reason. Because it makes people happy. It makes them more amicable, friendly. They become more open to ideas. Their mind creates more ideas. Then this is the third one, which is very important. It's called the pain relief chemical, um, endorphin. How do you get this chemical? Laugh, smile, and laugh. Why do you think you become happy when you watch stand-up comedy? When you hear a joke and you laugh? Why do you like people who make you laugh? Why do you like people who have good sense of humor? Is because when you are with them, this chemical gets created in your body and it makes you happy and you're automatically drawn to that person. There's something about it. Your body is just designed. You don't have to articulate that. You don't have to tell yourself, oh, I love this uncle of mine because he just cracks these lovely jokes. Because that chemical is created, you automatically develop that affinity for that person and you become happy. Exercising, just get up and exercise and see what happens. I think we have a session tomorrow where we are talking about the importance of physical fitness for mental health. But exercising, it creates this chemical in your body and you become happy. If you're not in a good mood, you're frustrated, just take a walk, take a bike, ride, pull some weights, do some push-up, do some pull-up. Exercising creates happiness chemical in you. It's the pain relief chemical. So if you have any kind of the thing that's bothering you, do one of these things, one of these three things, and that pain will get out of your body. And when that pain goes out, happiness gets created. Music, listening to music. And again, we all know that, when you're in a bad mood and you're frustrated, you're not happy, you listen to music, you forget things. What happened? Your music, like I'm listening, I have my earphones on. If I have a music on, I mean, my situation hasn't really changed. If I didn't get the grade I wanted, if I didn't get the job I wanted, if I didn't get the funding I wanted, that situation hasn't really changed. 5 minutes ago, I was living with that situation. I wasn't happy. I was disappointed. Then I put the music on and suddenly I feel better. What happened? Something got to happen because just listening to music, can't just bring my pain down. Something else must have happened. And that something is this chemical. This chemical, your body is amazing. Your body responds to certain things. You just got to know how to work with your body. Just like when you're driving a car, you can honk, but you need to know how to honk. It'll change the gear, but you need to know how to change the gear. It'll go fast, it'll go slow, it'll go left, right, back, forth, whatever you want. But you need to know what to do. This is exactly how our body works. You exactly need to know. These are some of the tools you need to play around and you'll get happiness. And finally, serotonin, which is a mood chemical. And this is amazing too. I mean, uh, just go out in the sun. Make it a regular habit to absorb sun. I know in India, especially in North India, it's very hot. But, just absorb the daylight. Don't stay indoors for too long in this artificial light. Get out and get exposure to light. Your body reacts to it. Your body trains itself to become happy just because of the sunlight. Nature walk. Go to nature. Just sit under a tree, go to a garden, take a walk. If you have any natural thing, anything that's natural, look at the cloud, look at the mountains, whatever you have. I know not all of us have the luxury to have beautiful nature around us, but whatever little you have, if nothing else, just go look at your plants or look at the trees on the streets or the sideway service lanes. Find something that's natural and look at it and just let it absorb. And and the last thing is being mindful. When you're mind, what does it mean? Now, mindfulness, we have a session on this, but in very simple terms, mindfulness means just look around you and pick one thing and think about it in a deeper way. For example, let's say I have a mug here, this mug, ceramic mug. I want to put myself in a state of mindfulness. What I would want to do is look at the mug and think about where it came from, who made it, where did the clay come from, where was the cast, where was it built, who sold it, how whoever sold it, whatever money it was sold for, who set the price. Think deeply about it. And there's this one form of meditation, I think, I'm forgetting what it's called, and I participated in it a long time ago. And the trainer gave me a little cashew nut and said, "Here, hold this cashew and imagine the whole journey of this cashew. Where was it first? Where was it first planted? Who was the farmer? How did that farmer look like? Was it a man or a woman or a child? Did he have a family who lived far away from where the farm was? Just imagine everything about that little cashew. Was it planted in some other country? Did it come to the US from Latin America? Which country? Did it come by sea? Just become mindful about small things that are around you. Think about your house. Just look at your house and think about it. When was it first built? Was Which part of my building was built first? Who built it? How long did it take? What kind of workers worked on? Just think about it. Go deep and start imagining these small things. And this is at the very core. This is called mindfulness, and it will. As you do this, you won't realize, but your body knows. You don't have to think everything. When you put a key in the ignition of the car, you may not know how that thing works. You may not be a mechanical engineer to know what is going on. When I put the key in, what happens, what reaction happens, what happens in the car that it gets. You may not know anything, but that does not prevent the car from getting started. The car starts and it moves. And that's how your body, you may not realize that these chemical reactions are happening, but they'll happen. All you have to do is to do some of these things, and body will automatically identify it and it'll start responding. And the response would be happiness. Um, all right. So with that, I like to go to questions. I know there have been a lot of questions. I got many in my text messages, and also Arnav probably has some questions. Um, so one important takeaway is please remember that happiness is caused. Happiness is not something that comes from something. It happens from you. You control it, and you control it 100%, almost 100%. Because as you saw, you can just do these things and your body will respond. So don't ever think that happiness is because of what college you go to, what job you have, what house you live in. Long time ago, they did a research here in the US, if I'm not mistaken, and it was published by the New York Times. And they were trying to understand who are the happiest people on earth. Who are these people who are very happy or who are happy most of the time, despite whatever their conditions are. And guess what? What they found out. The happiest people they found out were construction workers. And the reason they quoted was because these construction workers start with nothing. When they start building the building, there is no building. There is no wall. There's nothing. They start from zero. So every day they see the progress. And now imagine all of the things I mentioned. If you're a construction worker and you're building something, there was nothing. Every day you see progress, and that results in seeing something, and you do it all the time. Yes, you may be poor, you may not have nutritious food, you may not have fancy house, but your body doesn't know all of those things. Your body doesn't derive happiness from fancy car, fancy house, fancy job, fancy title. These are social construction. These are what we have created. Our body is designed to interpret some of these things. Our body behaves based on what is happening inside it, and you have all the control. So I would say go out and press some buttons. These are all the buttons we have. There aren't very many, and you will be happy. And if you're happy, you will succeed more. There are a lot of research being done to prove that happy people also have better relationship. Happy people live longer. Happy people are successful business people. They're more successful than others. They uh, they are more productive people. They make a bigger impact. And just go out and Google and see what happens when you're happy. And it's very easy. I mean, it's not very difficult to be happy, and you can see it. These are literally step by step. So you can make a to-do list, take a bath, go take a spend some time in the sun, walk, talk to people you like, meet family members, hug them, shake hand with them. And just I want to go back again just so that you remember, go to the nature, take a walk, go to the sun. think about things around you. Don't take everything for granted. You have very um, sophisticated things all around you. Your cell phone is very sophisticated device. You don't have to think about the journey of your phone, because they pick up a mug, pick up a cup of tea, and think about that tea. Where was it grown? Who got it? Who packaged it? Just being mindful about it. Exercise. Hang out with people who laugh. You laugh. Don't hold yourself. Listen to good music. Make it a regular habit. Whether when you go to bed, listen to music, or if you have some time, spend some time listening to music. When you're going on a walk, listen to music. Um, and if you can get a pet, it makes a lot of difference. Help people. Always find a way to help somebody, not because you want to do some good to someone else, but for your own sake. Helping others will create something in your body and you'll become happier. So find a way to help. And just socialize. And then some of these things very easy. Take good sleep, take a bath regularly. Not because you have to take a bath, not because you are sweaty and dirty, that's why you're taking a bath, because your body needs it, and your body will create a chemical. Eat food on time. Don't remain hungry. Don't miss meals, because that will cause unhappiness. Your body wants to be rewarded, and food is one of the ways. And finally, set goals. Every day, set small goals and achieve them. And these are very small goals. Again, you don't have to make the mother of all goals. Small little things, because your body doesn't know. Your body doesn't think in terms of, is it a big goal or it's a small goal. Your body is like, that goal, is it achieved? It is achieved. Okay, I'm going to release the chemical. Your body doesn't think whether you're going to build the next iPhone, or you are just going to do a little walk that you promise yourself. The body doesn't know all these things. The body just knows you have set the goal. Have you achieved the goal? The moment you achieve the goal, whatever it is, your body, boom, it presses the button, and it just created that dopamine in you. So, all right, with that, I would like to stop and take some questions.
So, Sayed, that was a really nice presentation. So, the first question that we have is, how do you think that the environment in which you live in impacts one's happiness?
It really impacts us. And as I said, I think the car example is pretty appropriate and easy to understand. You you may be a very safe driver. You may have gone to a driving school that has taught you very well how to drive safe. But if you are in an environment where everybody else is a reckless driver, if you live in a city where nobody follows the traffic rule, then uh, sooner or later you're going to be in accident. Not because of your fault, because of their fault, because of someone else's fault. So the environment that you're in, it's absolutely very important. Watch out for people who are complaining all the time or whining all the time, who are just negative, because just stay away from them. And if you can help them, pray for them, but don't let them take away the happiness that you deserve, because your happiness causes happiness, your brothers and sisters and everybody else. You it is your responsibility to be happy. It's not just being selfish to be happy, because when you're happy, you make such a good impact around you. So take it as a responsibility, and as an extension of that responsibility, be very aware of your environment. Negative people who are always, or news, for example, always watching news that's negative, or engaging with things that doesn't make you happy, doing something that doesn't make you happy, and it happens over and over. For example, career choices. Our system, our education system in India and in many other countries is very focused on grades and standardized tests. And if you don't do this, you're not going. This is not going to happen. If this doesn't happen, this is not. It doesn't. There are no evidence for this. Look at what happened. For standardized testing was around for how many years? One pandemic, and suddenly it's gone. I mean, we were all getting up in the morning, getting ready, putting the dress on, putting the tie on, and we were going to school. One pandemic, and schools are shut. We are all studying from school, from home. Everybody's working from home. Google folks are working from home. Apple folks are working from home. I mean, it's not really a big deal. So there are situations, there are people, there are stuff which are negative. Be very aware of it. Build your environment. Stay away from situations and people who do not recognize these small things, who do not want to be actively happy, and they'll cause unhappiness to you.
So the next question that we have is, with the pandemic, all the meetings have been online, and there hasn't been a lot of face-to-face interactions.
Mhm.
So how do you think that affects one's happiness? Not being able to meet people regularly who you like or who you hang
I
out with.
mean, it affects a lot because, here, look at this one. This chemical will not kick in your body if you don't socialize with people you like. And if you don't help people, if you don't have physical bonding, there is something about human beings, being physical, in the sense that you're petting your animal, that's being physical, or you're hugging your friend, or you're just in close proximity to your friend and you're having a face-to-face conversation. They are directly involved. I mean, they really affect your happiness levels. So pandemic unfortunately has, one of the reasons we are having this conference is because pandemic has created so much of distress and anxiety and stress. And if you narrow it down, I think what it has done is it has reduced the level of oxytocin in our body. I don't think we would worry too much if the level of this chemical hadn't gone down. I don't think we will even have that question. The level of this chemical has gone down because we're not able to meet. We're stuck at one place. Our tendency and ability to help people has gone down. We're constantly being told, don't go out, this will happen, that will happen, lockdown, you cannot, you're just surrounded by these sort of, this negativity that is telling you to, watch out. You're always on a sort of a, you're always guarding yourself, you're on alert. And that causes, it really does affect. I think pandemic has absolutely caused a lot of stress on our society, and I think part of it is the reason that I think these levels are going down.
Okay, so there's this question in the chat from Fozia who asks, being grateful and able to appreciate things around can make people happy. So how can this be learned or taught?
Yeah, I mean, they obviously make you happy, and these are tested things. The most beautiful thing about these things that we spoke about and what Fozia is talking about, you can test it. Just try being grateful for a week. Get up in the morning and write 3 things that you're grateful for, and see what happens. This is an experiment that all of us can do. It is not, we don't have to just believe the research. We don't have to believe the experts who are studying these chemicals in our body and how much can, forget all of that. Just do an experiment, run an experiment, do a small experiment. Every day before you go to bed, write 3 things that you're grateful for. Comfortable bed, good parents, good school, had a good meal, whatever else, just write it down and in the morning read it and let a week pass by and see what happens. It is unfortunate that we don't teach these things. It is absolutely unfortunate. I hope that this is a wake up call, the pandemic. I hope we start focusing on these important things in life. Because if you do these things right, we will have a completely different kind of nation. Just imagine over 1 billion people in India alone. Everybody is conscious of this. Everybody starts writing. Everybody is actively seeking happiness by doing these things instead of whining about, I want a little bit of more raise, I need a bigger car, I need a better house. Like, these things don't do anything. They really cause unhappiness. But imagine all of us, just the cumulative effect of it on a nation, what will happen? We'll have a completely new nation. So it is, Fazia, you're right. I don't know how we can teach it. I think it's pretty commonsensical. It's science. Everything that we're talking here is basically science. It's a very specific kind of science. I hope we teach it in school. I hope our policymakers recognize this and start talking about it. And I think we shouldn't depend on policymakers. I think parents who are listening to me and counselors and all of you young people, just start doing it. Don't wait for somebody to change things. As I said, this is well within your control. You don't need anybody. You can do this on your own. And yeah.
So we've got a last question from the chat from Anish, who asks, if a person during this COVID period loses someone who he loves or moves to a state of grief, how do you help the person to move out of that?
Well, that's a very interesting question, and it's not easy to answer because grief is a very sophisticated thing. It doesn't leave human beings very easily. First, just recognize it will take time. You just cannot take somebody out of grief, or you can't take yourself out of grief. If it's a grief, it is a serious thing. You don't grieve small thing. My cup breaks, I'm not going to grieve it. Obviously, if I'm in grief, something serious has happened. And when something serious happens, all you have to do is to give that seriousness the time it deserves. Um, and again, as I said, because this is a science, if you have somebody in the family who's grieving and who, is not able to come out, just go back to these slides and see what can you do to create that chemical, which is the pain one. This was it, right? Endorphin. Can you make that person laugh? Can you go for a walk with that person? Can you play some music that that person likes? This will take the pain out. You don't have to sit down and counsel. Counsel is important, it's absolutely important. But you are not a counselor. So what can you do? These things, crack a joke, watch Charlie Chaplin together, go for a walk. I don't know, get some exercising machine and just exercise together. Your goal really is to help the person who has grief, and a best way to do it is to create these chemicals.
So thank you, Syed. Is there anything else you wish to share before we leave?
No, I think we are really out of time now, the last 2 minutes, and our next speaker is here. Nashelle is here. I'm very keen to listen to what she has to say. I don't want to take any more time, but thank you so much. I would love to answer any questions, put it in the chat. I'm still here, and you have my email. I can help you in anything. Thank you.
Thank you.
Thank you, Syed. Bianca, that's you in again. And we'll just quickly get Nashelle in. Syed is just going to add her as co-host. And Bianca, please go ahead with your introduction. Over to you.
So, Nichelle Crowder is the founder of Evolve Generation, where she has coached and led high performance teams in the fields of media, special forces, education, health, and technology. Her unique background enriches her ability to help teams achieve tangible results. So, today she'll be talking about how we can destigmatize mental health by creating a culture of resilience. So, hi, Nichelle, how are you doing today?
I am very well, thank you, Bianca. Thank you for that lovely introduction there. I am just getting my screen up, so I'm hoping that I can switch from a client's background to mine. So let's do some nice fresh grass. How about that? Okay, can you see my screen, Bianca? Is that all right?
I don't see it yet. Yes, we
yes,
can.
You can. Okay, perfect. And you can see me. I just want to make sure that you can hear and see me. Is that good?
Yes, it is.
Okay, amazing. Well, thank you so much for introducing me there, Bianca, and thank you so much for this massive opportunity to speak to your amazing conference and your students and parents and educators. It's a real honor, and I am dialing in from the UK here. So thank you for that. So I have a question before we begin. Who has heard of 007? Pop it in the chat. Anybody heard about 007? The name's Bond, James Bond. Yes? Okay, great. So when I was a little girl, I wanted to be the female version of James Bond. However, in the UK, and still to this day, no female can join the special forces. So I, at university, decided that I was going to join the reserve forces. So it's a bit like the officer cadet sort of organization. And so I got my bit of fix of, sort of being a female James Bond there. However, throughout my career, I was in a fortunate position to be able to lead a task force of ex-SAS and special forces team members on a private reconnaissance mission for missing children across Europe. So obviously, when you're in a team, you have to be a great communicator, be self-aware, be socially aware, be able to manage relationships, and be a huge team player. And obviously, these skills were all necessary for being a leader and being a great communicator, but most of all, resilience was a huge play and characteristic that we needed to be part of that team. So obviously we were involved in those expeditions and those missions, and it was sometimes the difference between life and death. So we had to be really on our game and really self-aware and aware of our team members around us. Now, these 4 traits of socially aware, self-awareness, great communication, and self-management are also known as emotional intelligence. And emotional intelligence is learned, it is learnable, and we all have choices to upgrade our software for ourselves, right? But only if we're motivated and willing to do the work. So here at Evolve, we're really, really passionate about joining the dots between the parents, the community, and the school, and building resilience and emotional intelligence in our children. So my name is Nichelle Crowther, and I'm flying solo as a mother of 3 teenagers here in the UK. And over the last 8 years, I've had to become emotionally resilient, as my children's father hasn't been around for the whole 8 years to support them. So not only did he divorce me, he divorced my 3 children, who were all under 12 at the time. So he hasn't hugged them, he hasn't told them he loved them, he hasn't supported them or spoken to them in those 8 years. So I've had to explain to my children what it means about our inner sat-nav. We all have choices around how we show up, whatever age we are, at the point of where we become aware of who we are, communicating with. So even right from school age. And we should never allow someone else's emotional instability to affect our emotional stability. And that is really key to what we're going to be talking to today. No one said life was easy, but we can learn to become mentally strong, and we can learn to build resilience. And I'm going to share some little tips and tricks with you, and then we'll have Q&As at the end. So how do we become resilient? Well, it starts with understanding emotional intelligence. And as I said, we've got self-awareness, social awareness, self-management, and relationship management. Now, these 4 traits are really key in if you're a student, if you're a teacher, if you're an adult, parent, or business owner. Now, in my opinion, emotional resilience and emotional intelligence should be taught in schools. As human beings, we should always be constantly upgrading ourselves and always be the student. There is never the finished article. So if somebody says there is, they're telling you a big fat lie. And perfection doesn't exist, contrary to social media. So let's look at these 4 traits and why working on these will build us resilience. So self-awareness is about knowing our inner state. We're going to just let Navia in there. I'm sure somebody's handling that. And it's about how we show up emotionally. And then we've got social awareness is about empathy. It's about being able to understand somebody else's perspective. We've all got opinions. We all sit around a table and discuss and debate, the world's problems. But it's about having the empathy to understand someone else's experience, someone else's perspective, and respect that, because my way isn't the right way, your way isn't the right way. And, we all have different opinions, otherwise the world would be really boring, right? So it's about understanding that, the world is diverse, we've all got different opinions, we all show up differently. And this is huge for teamwork, especially now as the world community has become smaller. So self-management. Are you a positive person? Are you a negative person? Are you a half glass full or a half glass empty person? And do you have a healthy, respectful perspective, again, of other people's opinions and views? Self-control. Can you perform whether you are under stress or whether you are, in a normal working or studying environment? Are you proactive? Are you a reactive person? So how do you show up under sort of moments of stress or pressure? And then relationship management is, around being a team player. So there are 2 really well-known global corporations, Google and McKinsey. And more and more corporations like this are looking for team players. They're looking for students who collaborate, communicate, connect, and can work together really well in a team. So just like these phenomenal students here at Ecology, okay? And so the higher up the career ladder you go, or the better leader you become, the more emotional intelligence matters, especially in business. And get this, this is a really good kind of thing to remember. People are hired for their IQ, but people are fired for their lack of EQ. So, so what is, oh, somebody's not allowed me to share my skit. Oh, there we go, sorry. So what is resilience? Okay, so 2 examples of resilience are an elastic band being stretched, being put under pressure, but then the ability to bounce back and return to its normal state. Okay, and then the other sort of example is a sick person, goes through a little bit of an immune system sort of breakdown, but is able to come back, bounce back, recovering with good strength and good spirits, and good humor. We like a bit of humor. So it's the ability to thrive and survive. And, we know that the whole globe is going through a really challenging time right now. But we're all connected, and you're not alone. We are all experiencing challenges. And challenges are not a sign of weakness, right? They're an opportunity to show our strengths. It's an opportunity to shine. It's an opportunity to grab that challenge and say, do you know what? I'm not going to let this beat me. I'm going to try and get over that hurdle. I'm not going to be a victim. I'm going to be victorious. And we all have that choice. It's just whether we want to put the work in to start moving forward. Some people have challenges every day. Some people have challenges less often, but it's about that perspective around what those challenges are. So is there a solution? I often say to my children, mind map what you're feeling, and then let's explore what that looks like. Mind map if you've got a problem, what could the solutions and the options be? So there's always solutions in my book. I'm a real solution focused person. And if you're prepared to do the work, our life experiences often teach us how to grow and build resilience, sometimes without us even knowing. And, we all know what physical pain looks like, right? So if you're a child or you're a parent, you've had a child and, you've cut yourself or they've cut themselves, and we run around, going to find the plasters or take them to the hospital, get the stitches stitched up. Or if we have a sports injury, if you play kabaddi or cricket or hockey or netball, whatever it is, or soccer, we know what our physical pain is, and we know on a scale of 1 to 10 what that looks like. But when we've got emotional pain, no one can see it. If we don't communicate it, no one can help us. And if we ourselves, if you don't know on a scale of 1 to 10 what your emotional pain is, we need to be able to teach children and students and young adults what that looks like. So, if we can't feel, we can't heal. And that's really key to moving forward and growing mental strength and resilience. So, so how do we respond, right? So how many of you have been dumped by your first boyfriend or your first girlfriend? Do you remember that feeling? Oh, so I'm sure most of us have been there. But how did we respond? Did we mope around? Did we sort of, were we really down and just ate, Haagen-Dazs chocolate ice cream all the time? Or did we go, you know what? I'm not going to let them see that I'm really sad. I'm going to try and bounce back. And that's what resilience is. It's that springing back to a normal state. But that's not to say that you don't share how you're feeling, that you hide that, because you've got your close network of people, right? So you've got your friends, your sisters, your brothers, your parents, and you can share that those feelings with them, because there's great courage in being vulnerable. And again, that courage, if you show that courage in vulnerability or in vulnerable moments, you gain respect from your peer group, you gain respect from your community, because what they see is strength. And they see emotional intelligence, and it's inspiring, and they want to hang out with you, right? So it's a really good thing to share our stories when we're not feeling happy or we're feeling anxious, so that we can all help each other. And when you've gone through that particular experience and you've shared that vulnerability and learn from it, you are now in a position to serve others. You are now in a position to help somebody in your community grow like you've just grown. So it's a really great organic ongoing process that this kind of resilience idea concept throws up. You know, and it's really important to accrue a set of these learnable skills that you carry around in your backpack, you know, as you go through life. So once you've mastered them, once you've learned them, and you're adding to your arsenal all the time, you will become a great leader, a great parent, a great spouse, a great member of your community, and possibly a world-leading game changer. So how many of you go to the gym? You know, we go and work out. How many of you, if you're parents or teachers, go and take your car to go and get maintained once a year? But how many of us go and work on our mental strength? You know, we look after our cars more than we look after our minds. You know, we need to be really present and mindful about this state that we need to be in. So, you know, our emotional strength comes from our inner sat nav, and we need to know what our inner sat nav is capable of and where it's capable of taking us. Now, it's all about our human spirit, right? It's about our soul. And I've just devised a little acronym for our soul. So S is about gaining strength and support from others around us. And O is about overcoming that pain, overcoming that adversity. And U is upgrading our software, upgrading our inner sat nav. You know, throw out the old one, let's bring in some new tools and new skills. And then L is live to love. So that's my little acronym there. So if we just go to the next slide. So we communicate every day, okay? And everything we communicate comes from two places, either love or fear. So you either come from a great place of serving others, or you come from a place of concern or a place of anxiety. How many people have heard of Stephen Covey's The 7 Habits of Highly Effective People? So he talks about the circle of concern, and he distinguishes two groups of people. So you're either a reactive person or you're a proactive person. And I mean, some days we're actually a bit of both, right? So none of us are perfect, as we've all come to understand. But it's about, in our circle of concern, a lot of people focus on a lot of things that take up noise in our head. And there are a lot of things in the circle of concern that we can actually control and influence ourselves. And the idea is to shrink our circle of concern, but expand our circle of influence. So do you communicate from a place of fear or love? Are you angsty all the time? Are you anxious? Is there something inside? Is your energy off? Are you out of kilter? So we can identify that reactive people are often coming from a base of fear, and that proactive people understand they need to grow, understand they need to be accountable and show up, and come from a place of love. So it's easy to categorize these two people, but we need to identify, for us, we need to be responsible about how we show up. And so the circle of concern is like the reactive zone. It's our inner negative talk. And, you know, it might be, you know, first world problems. I wonder if that boy or that girl likes me. But in all seriousness, you know, there will be some, you know, bigger issues. You know, for parents, it might be, I have to deliver a shareholders presentation tomorrow. And so, you know, everyone, it's good to have that nervous energy, but some people can be all consumed by huge anxiety, like going into exams, for example. So we could say that we become victims to circumstance, and we let circumstances control our lives. But actually we can reframe it, and we can control the outcomes. And it's also about, how do we show up in these certain scenarios that we are faced with? So if we're in reactive mode, we only focus on the concerns, and they dominate our thinking, but we need to shrink that fear. So we can choose not to focus on that circle, but go into the circle of influence. Now, the circle of influence is the proactive zone, and it's the positive talk. It's all the, I am going to achieve this. I'm determined to do that. I will do this, rather than I can't, or it's not possible, or I'm not possible. And the circle of influence, which is the proactive zone, is also our growth zone. So it comes from a place of love. So we can learn to control our nerves. It might have been in your circle of concern, you know, my nerves about my anxiety, but if we give you breathing techniques or meditation or visualizations, or we prepare enough, we revise enough, then we are in control. So it becomes part of our influence. So therefore we are growing our circle of influence and shrinking our concerns. Now, remember, confidence is a feeling, it's an emotion, and it's a learnable skill. And with the right support and guidance, you know, we can all grow our confidence and our self-esteem. It's only, you know, we look at all the little kids in the playgrounds at 4 and 5, they're full of confidence, most of them. It's only when we get older, when we get told limiting beliefs, you know, you aren't good enough, you can't do this, your body shape is this, you are not great at this. And we take all these negative thoughts and we put them in our files in our head and we carry them around with us for the rest of our lives. So I'm saying, let's blow those negative thoughts away and start to control and influence our internal voice, our internal talk. So if you're proactive, you can often take criticism and feedback constructively, and you take it with love and you go, thank you for sharing that I understand that you've shared that with me so that I can improve myself and be a better human, a better student, a better leader. But often people who are in the reactive zone, you know, are defensive, and they react by maybe sort of being a little bit angry or a bit offended or lose their temper. And so this is how you differentiate where you fall and how you can start to grow yourself and take action. So obviously, in extreme life circumstances, a person with a proactive mindset will move forward at a pace that is, you know, manageable and achievable for them. But, you know, for example, if we are processing grief or loss, and in a healthy way, we can move forward. But rather than trying to avoid it and block it out by something like alcohol or stimulants or sleeping or depression and not communicating how we are feeling, that's when it doesn't serve us. So we need to avoid allowing us to be consumed by things that often we would feel would challenge us, and take them as a learning opportunity to grow our resilience. So, you know, the aim is not to place our energy into our concerns, because we could give so much more energy to our circle of influence. So even the Dalai Lama said, if there is no solution to the problem, don't waste time worrying about it. But if there is a solution to the problem, still don't waste time worrying about it. Okay. And it's all about mindset, right? So anything is possible, you know. So if you were to write down the word impossible, just quickly write it down on your notebooks, tap it into chat. And what do you see there? So I'm possible, Avneet, perfect. Okay, brilliant. Exactly. So impossible, etymology is fascinating. It's all about, you know, what's our perspective on something? I always say to my kids, everything is possible within reason. You know, there is always an opportunity to go and try something, and failing is to be celebrated. If we don't fail at something, if we don't give something a go, we will never grow, and we will never gain an experience that we can share with somebody else. And yes, Daksh, that's brilliant. Impossible, it says itself says, I am possible. I love it. I love it. Perfect. Thank you. You're making me feel like I've got some friends now when you're interacting in the chat. Okay, so it's all about the mindset. It's all about the reframing and being brave. And when we feel vulnerable, sharing our story so that we can resonate with somebody else. So I'm just going to quickly move a couple more slides, Bianca. I know we're sort of, I'm not able to move my slides forward. But I just wanted to cover off. So resilient leaders, if we look at Maya Angelou, if we look at Gandhi, and if we look at Mandela, all of those people were able to have huge resilience, which pulled them through their hard times. And Maya Angelou's poem, I Still Rise, is massive. She said, I can't actually share my slides, so I'm not sure if there's something technical going on, but she wrote, you may trod me in the very dirt, but still, like dust, I'll rise. And this shows her resilience about no matter what obstacles she faces, she was determined to get freedom on the agenda. So I've got one little last slide here, which I still can't process. And I'd like you to write this mantra down. And this is a three-pronged approach to resilience from Dr. Edith Grothberg, who's a PhD, and she wrote a brilliant paper on the International Resilience Project. And she says, I have people around me who can support me. I am able to be responsible for myself. I can find help when I need it. And then last three tips from me about upgrading ourselves, our mental strength and our resilience is be open and embrace change. Don't dwell on the negative. Go on a daily basis and have self-reflection and get to know yourself really well. It will make you a fantastic human being. If you can reflect on each day, what went well, how you showed up, how you responded to something that maybe didn't go well, that's being really emotionally intelligent. And you need to grow this, because remember, if you want to be a leader of a big corporation, you will be retained and not fired for having a lack of EQ. Set yourself mini tasks each day. So create goals, do meditation, do some physical exercise, do something that is going to grow your mind, body, and soul, and take action. Don't just think it, don't just say it, don't just write it in your diary. Actually go and do it, because it grows your mind, your body, and your soul. And then be positive, be proactive, go and have a growth mindset, have fun and find joy in what you do all day, every day, with a great sense of humor, and develop a strong personal connection with everyone around you, and be kind and caring. So Bianca, I hope I didn't run over too much. I know we've got some Q&As, and over to you.
So first of all, thank you for that session. It's very important now to build emotional resilience, especially during this pandemic. So in your experience, how is building emotional resilience in your childhood different from building it in your teens or early 20s?
Now I'm really old. I'm 51. So I didn't know about this stuff when I was younger, right? So you guys are so lucky that there's so much knowledge out there. And I kind of knew what I wanted to do. I knew I was going to be in service to others. I knew I wanted to deliver a purpose. But it wasn't until I got older, I kind of realized what I wanted to do in terms of helping people in the education space. And Steve Jobs does a brilliant, I think it's Stanford University graduate speech on YouTube. You've got to go and look it up. And he talks about joining the dots. So it's like, when you started younger at university and you left university, you weren't particularly sure where you'd end up, but then going through life, you look back and you go, that's why that happened, that's what that lesson taught me. And so I think at every stage we need to be teaching really primary, early years kids about emotional intelligence and equal dignity. Then we need to be building on that for teenagers so that we grow them into the leaders of today. Thank you, great question.
Yes, I agree. It's very important to build emotional resilience among teens. So in your experience, what are some of the challenges you have faced while helping others, particularly young people, build resilience?
Oh, so what challenges I face? Well, I think I was involved in a situation where quite a few teenagers were going to be expelled from my son's school. And I was really incensed that the school, so it was a private school here in the UK, and I was really incensed that all they wanted to do was protect their brand. It wasn't about the students. It was about, getting rid of these children because they were going to damage the brand and the PR that would come out of it. Now, if you're in education, that is so wrong. Okay, we are responsible as adults for supporting our teenagers in the emotional stages of their neuroscience development of their in puberty. And that can go on until they're 20, 21, 22, 23. People develop at different ages. So I stood in with a group of parents and we challenged the school on expulsion, which is an adult concept of punishment. So if anybody's read the Steve Peters, the chimp paradox. He talks about the inner chimp, but he also talks about expulsion and how that is really the wrong thing to do. It's an adult punishment, yet we implement it into our schools, and we, at a time when our kids need support, they need guidance, and they need steering back to their North Star. But what we do is we just kick them out of school and go, somebody else's problem. That is not education. I don't know what that is, but that is not education in my book. So expulsion for me does not work. So I found that challenging because I was challenging the education system and trying to get this change. And that's why I started Evolve.
Wow, that's really great. So I think we have a question from the audience from Urja. How do you deal with pressure if you have a lack of confidence?
Okay, so it's kind of two things there. So there's the confidence thing and there's the pressure thing. So you can grow your confidence by learning to love and know yourself first. So it's a journey. You have to start building your inner tower of strength first. And I did share, sort of a few things. It's like, breathing techniques, or if you've got something that really gets you into a space where you can have some headspace. If you love painting, if you love playing music, find your thing that gets you into that Zen state where you can reflect on who you are and how you are. And also learn to love yourself. Here's a little tip. If you can look in the mirror and look at yourself and say, Michelle, I love you, without feeling weird, that you have to get comfortable of loving yourself, because then things are possible. And you can then start to grow your confidence, and having experiences grows your confidence. So hang out with people who feed you all that love. So, you need to, they always say that the top 5 people that you hang out with are the soul sum of who you are. So go and find those people in your community. Don't go and look for the negative people. Go and hang out with the positive people. Go and hang out with the inspiring leaders. Go find somebody that can inspire you and guide you and mentor you to do what you're passionate about. Grow your confidence with them. And then dealing with pressure it's back to that circle of concern. It's your mindset. It is, is this really a pressure? Can I find a solution for this pressure? Can I find help, support, and guidance for this pressure? And I have to communicate what pressure I'm feeling. If you can't communicate, and this is an emotional intelligence point, if you can't communicate the pressure you're feeling, nobody can help you, and it just builds up, and then you explode. So we want to stop that build up, and we want to go and find somebody in your community that can help you. Great question, Orja. Thank you.
That was really helpful, and I think that concludes our session for today. Thank you again, Michelle, for this very insightful panel, and stay tuned for the next one.
Okay, good luck with the rest of the conference, and thank you, Bianca.
Thank you.
Thank you, Michelle. And we have Sam now. Sam, can you switch on your camera, please? Ooh, I like that picture you have on, Michelle.
Yeah, it's just full of energy, isn't it? Me too.
It is really needed in this session. Sam, can you get your video on?
Are we good?
Yes, there you are.
Is this
So,
on?
yes.
Hello.
Can
on.
Yeah, you're on. And great view in your background as well, Sam. Welcome. Students, here is
On the
Sam.
beach.
Yeah. The founder of Fulfillment Source Code, and Sam will tell you more about it. And he's written this fantastic book that I was looking at the other day. So Sam, welcome, and I'll just leave the floor to you to take it from here.
Thank you very much. I'm going to ask a couple questions first. We've got a number of participants. Please let me know. I'd say raise your hand, but just type in yes if you've been sitting down for about more than 20 minutes. Because if you've been sitting down for more than 20 minutes, have you been sitting down for 20 minutes? If you're listening, if you've been sitting down for 20 minutes, I need you to stand up. Okay, get up. Stand up for just a second. Just stand up. Oh, God, I stretch. I don't know about you, but after 20 minutes, I'm exhausted. My brain is already ready to go to bed. So everyone stand up. I say, give me 25 jumping jacks. Just get up for a second. I'm going to ask you a couple questions, but stand up as you're doing this, okay? Thank you. All right. Thank you, Nichelle. All right. Quick question. This today, I got to share my screen. I don't know how to do that. Who here has a problem with social media? Raise your hand. Just put your hand up. How do I share my screen? I think my keynote. I have no idea how to do this. This is here we go. All right. I'm gonna try and do this for the first time. All right. Let me know if you have any problems with social media. Who here looks at social media before they go to bed? Anybody? Does anybody look at their phone before they go to bed? It's okay. I'm not gonna tell your parents. Just let me know. This is I want to know. Anyone? Anyone? All right. Michelle, you should know better. Come on. All right. So we got some people. That's fair. That's cool. That's cool. Now, real quick, before I start today, and I'm going to get myself off so you can watch this. Today, we're going to go on an adventure. Okay. We are going to go through the jungle. We're going to go back in time. I'm going to share some things that your parents wish they knew when they were your age. And then finally, we're probably going to hear from some dead people. Yeah. So that's what we're going to do. Now, if there's a way that I can turn off, I don't know how to do this. How do I do this? I'm figuring this out as I go. I apologize. I'm not very good at this whole thing. I think I'm going to stop my video. I hope you can still see my screen. Do you still see my screen?
Yes.
Let me know if you can still see my screen. All right, good stuff.
Yes.
All right, I'm not going to try to not distract you. Let me see if I can do this though. Nope, that's not it. Play. That's still not it. How come this is not allowing me to go to the next? This is very strange. Share. I feel like I'm doing technical difficulties.
Yeah, just do a slideshow, Sam.
Okay, so this is what we're talking about. People being sad, pictures are happy, and the impact of social media on young people, and basically how to manage it. Now, I've got about 20 minutes to give you the why this is happening. And my goal really is to give you this information to essentially change your whole life. So let's see how I can do this. All right, so in a nutshell, it's about your brain, right? And brains ultimately want to avoid pain and seek pleasure. That, if I had to stop right here, that would be it. All right, good talk, everybody. But instead, let me change this up a bit, and let me start by blowing your mind with a little bit of a story, okay? Now, so when I was a kid, and this is a true story, my father used to say things like, it's okay to make mistakes, just try to not make the same mistake twice, which I thought was very fair, right? And then one day, I saw this ant walking along this rim of a wide, shallow bowl. And this ant, it walked along the edge, it made a full circle, and it kept walking, right? It went around the dish 3 times. And it dawned on me that it would continue on this path because it couldn't see the mistake that it was making. Now, we humans, we're actually not that different because the number 1 and the number 2 priorities of our human brains are actually the exact same as the ants. All right, I just want you to stay with me on this, okay? This is going to be important stuff. So there's this brainiac, this guy called Daniel Kahneman, who won the Nobel Prize, and he is the author of Thinking, Fast and Slow. And he talks about the 2 systems of the human brain, right? The unconscious and the conscious, the fast and the slow, the energy efficient and the energy inefficient. Now, if you are anything like me in like my first 40 plus years, I wasn't spending too much time thinking about my brain. Oh, where's this thing? Am I still in this? Oh no. I'm sorry. This just died on me. I don't know how to change this.
You're
My
still
computer,
there, Sam.
I don't. Okay, but unfortunately, I can no longer share my screen. I don't know how to change my screen. I don't know what I did.
Your screen, we can still see your screen thinking fast and slow.
Right, but I can't change it. It just stopped on me. Oh well, let me see if I can do this. There we go. Okay. Like me, you weren't right. Now, this 2 to 3 pounds of squishy mass between your ears is that every single thought, every single emotion, every single feeling, every single sensation, every dream, every experience that you've ever had or you ever will, it happens inside of your brain. I mean, if you think about it, if you think that your eyes are what see or your tongue is what tastes, just remember your favorite dream or your worst nightmare, and you'll realize that absolutely everything is a process of your brain. Now, these brains that we have, brains in general have been developing for like millions of years, right? And all have the same purpose. The number one priority of all brains is to survive. Because, well, if you're dead, nothing else really matters, right? But if you think about human brains, now human brains have been developing for like 200,000 years. And if you think about it, like 99.9% of the development time happened when like 99.9% of the stuff around us simply didn't exist, right? Think about it. 200 years ago, there was no electricity, there were no cars, there were no phones, there was no TV, and there certainly wasn't any social media. Now, another way of saying this is that your brain was developed and is much better suited for life 50,000 years ago, much more than, say, today. Now, your brain, it's like 2% of your body weight, right? But it consumes like 25% of the energy, right? Your brain requires a tremendous amount of energy, which then brings us to brain priority number 2. If I could press the button, and there you go. So the brain priority number 2 is to conserve energy. And this will make sense in just a second, which of course brings us back to the 2 systems of the brain, right? Most of all of your brain activity, it actually happens subconsciously, like 95% of it, right? Think of it like this iceberg here. So think about it. The vast majority of what's going on inside of your head, it's actually happening without you even being aware of it. I mean, could you imagine if you had to consciously think about breathing, about keeping your balance, about digestion, right? So one of my favorite quotes is this guy, you may have heard of him before. His name is Einstein. And he says, thinking is hard work. That's why so few people do it. Now, essentially, thinking, it's like the last skill that the human brain developed. And it requires a ton of energy, which the brain actually doesn't prefer. All right, so real quick recap, just to review, because reviewing is important. So number 1 priority of brain is what? It is survival. The human brain, it was developed more for like 50,000 years ago than today. And brain priority number 2 is to conserve energy. Because think about it, 50,000 years ago, it's not like you could go to 7-Eleven and grab a bite. All right, is everybody with me? Can I hear anything? Everybody with me? 3, 2, there we go. Thank you, thank you, thank you. All right. Okay. Now your human brain, it's smart. And inside every human brain is what I call a factory setting, like kind of like your computers. You got these factory settings. These are processes that like over the centuries were tremendously helpful, and your brain would prefer to not spend any energy. These are the things that are like shortcuts, survival shortcuts. Consider them like shortcuts for your brain, right? All these things that helped you survive. I mean, think about it. If somebody throws something at you, it's not like you have to consciously think, hey, maybe I should get out of that. No. If you had to think about these things, we'd all be dead, right? And your brain is absolutely full of these shortcuts. Again, these shortcuts, it's like this is what your brain wants to do, right? It's subconscious, you don't think about it, and it's your default unless, and here's the big thing, unless we consciously choose to override them, because we can. You see, all humans, we have a superpower, and our superpower is to adapt, because we literally learn better than any other animal out there. We're not super fast, we're not super strong, we don't have any cool claws, but we learn better than anybody. Okay, now our brain is the key here. See, when we learn something, we literally physically change the brain. Now, this thing is called neuroplasticity. It's not really that important. It means brain change. But okay, real quick question. Everybody, do you guys know what neurons are? Question, do you know what neurons are? Yes? No? Give me one. Thank you. All right. So if you think about this, like all of your thoughts and your actions, they actually correspond to various neurons firing in a sequence. And the more that you do it, the better they become. Like the more they fire together, the more they wire together. All right, so we're gonna go on a little hike here, okay? So think about this as if you were to go through a rainforest, right? Now, the first time you go through the rainforest, it would be really hard, right? I mean, that's a lot of work. But the person right behind you, or the second time you went through that same rainforest, it would be just a little bit easier, right? And then you go on and on and on to like the 100th time, and then it would be super, super clear, and you wouldn't even have to think about going through this rainforest. It would be automatic, right? So easy. So instead of this this rainforest, let's call it a brain forest. Get it? It's like a dad joke. Sorry, I'm a dad. I can do that. All right, so like, think about this. Remember when you first learned how to read and how hard it was? Like you had to think about all these different things. But now you probably don't even have to think about these. I bet you can't even look at a word without reading it for the first time. You do it automatically, right? You're now at that point. Again, the neurons that fire together wire together. And the more that you do this, the more automatic they become. Now, this can happen consciously, like when you learn to read, and it can also happen without you being aware of it. All right, raise your hand, give me a yes. How many people here have memorized songs or commercials or something like that without even planning on it? Raise your hand. Anybody? I know I certainly have. It's like, where's the beef? And I can't help. Yeah, there you go. All right, so repetition of something, whether you're consciously aware of it or not, it leads to the formation of these new automatic pathways, okay? And this is all critical. Again, repetition of something makes these things super clearer, stronger, easier. Think of it as practice. Practice doesn't make perfect, but practice makes permanent, okay? And again, it can be consciously or just on its own. All right, so real quick, we're gonna do this because repetition is important. It's important. Life, it all happens inside of your brain. And brain priority number 1 is survival, and brain priority number 2 is to conserve energy. And why is thinking hard? Because it's the last thing that we developed. In your brain, it prefers the shortcuts, which are basically better suited for life 50,000 years ago. And 95% of your brain activity is happening without you even knowing it. But your superpower is to adapt. That's right. You literally have the superpower to rewire your own brain. All right. Now, I would say, I want you to think about this. That was like 10 minutes. We basically went through the entire how and why your brain works. So good job, everybody. High five all around. High five, everybody. Good job. Good job. Good job. All right. Now, again, the default settings that we have, it's better for life 50,000 years ago. So take a moment and think, what was life like 50,000 years ago? Probably a little bit different, right? Yeah. Now, for the vast majority of people alive today, survival is not a day-to-day concern, right? Now, these shortcuts that we all have were developed under very, very different environmental conditions, right? These shortcuts that created these desires within us and actions that we take over and over again, they helped our survival. But today, the proportions are all off. Think about it. What was scarce back then is just super easy for us to get, right? Now, some of these survival shortcuts, unfortunately, they're killing us. Think about it. For the first time in human history, dying from too much food is actually a problem. Isn't that crazy? Like, to today's topic, humans were mammals, right? And mammals are social animals. In fact, our brains have been social longer than they've been human. So our brains are wired to compare ourselves to those around us. Now, not only is this like an immediate survival thing, but it's also a social thing, right? 50,000 years ago, it was really important to know where you stand in the tribe, right? For your various skills. Like sharing what you're good at was very beneficial for your survival. And being the worst, well, that could be considered a threat to your survival, right? Because if you're not if you're not helping out the tribe, you're out of the tribe. And if you're out of the tribe, game over. Now, 50,000 years ago, think about it. How often each day do you think you'd be able to see an example of where we're not good enough? Again, today, the proportions are way off, which then brings us back to today's topic. And knowing what you know now, how surprised are you that your 50,000-year-old brain software, it's being hijacked, right, by the billions of dollars behind the tech that's literally in the palm of your hands? Think about it. Remember how your brains avoid pain and seek pleasure? Well, there are a variety of neurochemicals that have already been discussed a little bit here that make you feel good, right? We don't have to go over all of these here, it's not important, but literally billions of dollars are spent by some of the brightest minds in the world researching how to use your brain chemistry against you. Think about it. We naturally want to have fun, right? We want to seek pleasure. So your natural instincts and desires in today's world, if they're left unchecked because of these proportions, can be very harmful. Okay, I think that's it for today. I can answer lots of questions. I can go on and on about sleep and how important it is and the blue lights and all these other things. But really what I want to do today is give you a chance to ask some questions. Because at the end of the day, I hope at the very end of this, you're not like that ant. I hope you can get off this path, and I hope you can find a better path. Now, before I go, I want you to all think, what was the most important thing that you got out of today's 20 minutes? Don't be that ant. I'm going to finish here. I'm going to find a way if I can stop sharing my screen. Boop. I don't know how to do this.
Thank you,
All right,
Sam. Those were some great points. We are running out of time, so we have quite a few questions from the audience. So let us head right to the Q&A.
All right.
Social media can be quite addictive, especially with young kids dedicating majority of their time scrolling through Instagram posts or even Snapchatting themselves with their favorite filter. With so much time being drawn into online activity, what is the effect of social media on the educational system and the students' ability to pay attention to their academic performance?
That's a great question. So Saeed went over some of the brain chemicals that we get. He talked about dopamine and oxytocin and serotonin and the endorphins. And understanding what is happening to your brain. Every time you're scrolling and you're like, oh, ding, 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 you get like this drip of dopamine. And dopamine, it's the reward chemical, but it's also highly addictive. Dopamine is that drug that gamblers get, okay? So first off, understanding that this is addictive. And I'm gonna say this. It's not that social media is bad, it's too much social media is bad. So if you understand that it's like, look, I can do this a little bit, too much is bad. Now what's gonna happen in your brain, because everything happens in your brain, is you're scrolling through, you're getting drip, 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 drip of dopamine, but you're only getting dopamine. And one thing Sai had said is there's ways that you can engineer things to make your life better. And the easiest way to feel good is to do things with or for somebody else. Now, one thing you can never ever get from a screen is dopamine, is oxytocin, which is by far is my favorite. And when you do things with other people, you're getting not just dopamine or serotonin, you're actually getting like this cocktail. And that's when the real magic happens, when you're doing things with or for other people. Because you can have fun playing video games. It's like, you get a little drip. But if you do something with or for somebody else, then you get more of that. And that's what's most important. So understanding what social media does to your brain is the absolute key. Because if you don't know you're making a mistake, you're going to keep doing that. So that's number one. The second one is you don't want to be addicted. And the best way of not being addicted is to basically control what you're doing. I hope that helped. So again, the other thing it does is it distracts, because again, we seek pleasure, and we avoid pain, and we get a little bit of pleasure when we're looking at our phone. It's kind of like a spoonful of sugar every single time. Too much sugar is going to not just rot your teeth, but it's going to rot your brain and not good for your body. And too much social media is the same. A little bit's okay, too much, not so good.
Absolutely. My next question is, As a matter of fact, we all know that kids in this day and age have become extremely smart, especially when it comes to using technology. Social media is a large platform, and with a click of a button, a picture can be posted online, which can be viewed by a mass number of people. Parents can be concerned about the safety of their children on social media. So, could you suggest a few ways in which social media activity can be monitored?
So the monitoring, well, okay, so I'm a dad. I have a 14-year-old daughter. And there's one thing that I do know is that I can try and control her with gates and locks and this and that. But I used to be 14 and it didn't work then. It's not going to work now. So the best way that I found is to inform my daughters. It's like, look, when you're out of the house, I can't control you. I don't believe that's the way to do it. It's about giving this kids the skills, the understanding on what they can do and what are the benefits and the detriments. And sometimes, as a parent, you got to let a kid fail once or twice to see the problems. And again, allowing the kids to do that, within boundaries, of course. It's as a parent, it's a scary time. But again, this is letting kids understand what is not just at stake, but what's going on in your brain and how you're training. It's like kids are smart, and give them the chance to thrive and also fail. As an entrepreneur, it's like fail forward, fail faster, because that's how we learn. We learn really well when we're like, okay, I think this is making me happy, but it's not making me happy. Let me be self-aware about that. Yeah, this isn't really working for me, so let's try something else. And then give them those options. They have options. Let them know they have options, and that's what's working.
Great, great. As per your panel discussion, you stated the impact of social media on young people. There is also a famous saying, people are sad, pictures are happy. Social media has often been utilized to mask the real pain faced. So, according to you, how are people able to hide their agony through the use of social media? And are there any solutions to this problem?
So one of the things that happens in social media, and I touched on this briefly, is like you can see within half a second, 50 million different people who have done some amazing things and how much better they are than you. And the brain looks at these things, and again, from our brains for 50,000 years, I look at it, I think about, I see it, and that's it. You're not thinking how many filters are on that we're taking or use, or how many fails were there before they nailed that one trick, or how many times did they get the lighting and do all of this stuff to show that best thing. So it's showing an incredibly skewed perspective of reality. And the other thing, so the most important thing is for kids to be like, okay, my brain is under my control if I choose it to be. And that's the kicker. Because you can tell your brain, you can use one part of your brain, your prefrontal cortex, to the amygdala, blah, 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 to say, okay, you're going to look at something like, oh my God, I'm just not good enough. And then another part of your brain could be like, don't be silly. Come on. You know that this person's using filters and doing these other things. And that self-talk, it actually works. And the cool thing is, when you decide to have that conversation, what you're doing is we're jumping off of this negative path that's already there, and we're choosing to go onto a more positive, more realistic path. And the more you do that, the stronger this one becomes and the weaker this one becomes. And it does take time. Think of it as like learning the martial arts or music or anything. It's like, it's going to take time to get better and better and better. And every day, if you can just be 0.01% better than yesterday, that it adds up. But every time you do it, and when you find yourself going, oh, this kind of sucks because look how good they look and look how crappy I look, you're like, no, come on, give yourself a break. Take some time. I'm a teenager, they're older or whatever, or whatever it is, but it's about you versus you. And every time you choose to go, no, I'm not going to take that path, I'm going to take this path, that one gets better and that one gets weaker. And that's what's important, because again, you do have that choice. You have the ability. There's a saying that I say to the kids, like, look, if you look for the bad, you're going to find it. But if you look for the good, you're going to find it too. They're both there. It's always a choice. Think of yourself as like you're on a bus on a road, and on the one side is the mountain, and the other side is this beautiful vista. You can look on either side. Where you choose to put your attention, your ride, right? Do you want the scary stuff, the horrible stuff where you're like, oh man, this is beautiful? You can make a choice. And you can, if you start looking there, you're like, no, I'm going to go over here. You can do that. And the more you make that choice, that stronger that becomes. And the more it is, think about it. It's like 10 years from now, you're going to be an expert. You're going to be so much farther ahead than where I am now.
Absolutely, Sam. Couldn't agree with you more on that. We have one last question from the audience. With this whole pandemic situation, most of human interaction takes place online. Sahana asks, how do we deal with the fear of missing out?
The fear of missing out is like, that's a big one for today, Hannah, that without a doubt, especially today where you're like, oh my gosh, there's literally 1,000 other things that I could be doing or watching or doing, and there's just not enough time in the day. So one, never before in human history has our brain been bombarded with so many options. Understanding that, okay, wait, just take a moment here. Not all of that is important, and it's okay. Part of what we're doing, it's like sculpting. It's like, didn't like this, I didn't like this, I'm kind of figuring out who I am. Understanding that you can't do everything, and that's okay. It's like there's that fear of missing out, and then mindfulness is like, be present here now and get the most of right now, and then do something else.
Absolutely. It was great to hear from you, Sam. Wish we could talk
Thank
more,
you
but
very
it's
much.
now time for our next panel discussion. Thank you for your time and hope to hear more from you in the future.
Thank you very much. You guys are doing a great job. Keep it up. Bye-bye.
Hi everyone. Next up we have Ms. Ikru Ullah. Ms. Ikru is a counseling psychologist based in New Delhi. Her fields of interest include psychoanalysis, narrative inquiry, and exploring maternal subjectivity. She presently supports young adults and teens offering counseling sessions online. And today she would be focusing on a very important aspect related to every child's mental health. That is, how can parents understand and support mental health issues? So before we start, I would like to say that the last 10 minutes are a short Q&A session. So do jot down your questions in the chat box below for Ms. Ikroop to answer. Ms. Ikroop, you could take it forward.
Hi, thanks Adya for the introduction, and thanks Kology for having me on this panel. I'll keep the thanks very brief because I'm quite nervous about finishing all this within 20 minutes. So you'll have to bear with me if I get a bit breathless through it. Let me just share my screen real quick with you. Okay, I hope my screen is visible to everyone. You can just send a thumbs up or something, Adya, if you can see my screen.
And yes, it's visible.
Okay, great. And thanks for everyone who's tuned in. I know it's the weekend for us, and thanks for taking the time out to listen, especially because listening is something I'm going to be talking about a lot today. So I really appreciate it. The topic I have is mindfulness and mental health fitness, and how parents specifically can better understand and respond to mental health issues. The approach I am taking to this is more on the lines of how we can initiate and sustain conversation around mental health and emotional life in general, which even under normal circumstances is essential, but especially now when children have to do a lot of figuring out of growing up, which was previously done in spaces like the school or university, and public space in general in a community sense. Well, there are online communities which are doing great work, but there is a very serious shift of how these things are navigated. So questions about our intimate identity, curiosities about gender, sexuality, changing feelings, our friendships, our relationships with people, with family, with food, with our bodies. All of these are confronted within a family unit, and that comes with its own unique set of challenges and potentials depending on what your family situation looks like, how much openness and dialogue exists to talk about confusing feelings. So this discussion is more relevant than ever now, I think. And it becomes more important to have an ongoing dialogue around our emotional experience. Okay. I'm just having a bit of technical issues, but yeah, we have this. So the first requirement for having a dialogue is to have access to a language to communicate these feelings. So in the case of a parent-child relationship, a lot of communication is often restricted to advice giving or in the form of instructions and directions and expectations, which doesn't leave a lot of room to discuss feelings, and particularly feelings of distress and an inability to cope and not meet these expectations that are made of them. And as a result, most of the attempts made by a child to communicate these feelings is either suppressed and then pent up, or the communication gets completely distorted. Let's consider anger as an example of how a feeling might be miscommunicated. Anger is in and of itself a destructive emotion. One second, can someone, I think because I'm co-hosting, I'm struggling to switch to the next slide.
We don't have a copy of this one. Yeah, it's showing up now.
I'm sorry about that. But yeah, as I said, anger is in and of itself considered to be a destructive emotion. It is difficult to bear not only for someone receiving it, but also for the one enacting it. And the attempt of squashing this anger instantly on the part of the parent is natural and logical on the surface, at least. And it might be out of concern that you put a stop to it. But like any emotion, anger also exists in varying degrees of intensity, and thus needing a varied set of responses which is best suited to its intensity. But when we are too quick to remove any and all expressions of anger, we lose the possibility of listening to that which is being communicated through it, which in many cases is the child saying, I am not okay with how things are. I need something to change. So anger here might be, in fact, a sign of assertiveness and the ability in the child to seek better circumstances. Also, it might be a sign that they are able to, the fact that they are able to express anger is indicative of a possibly healthy family environment, because the child feels a sense of safety and security in expressing an emotion like anger. They have a belief that the relationship between the parent and child will be able to withstand such a attack, so to speak. It is only when we're able to trust another person with our action can we deliver it, especially when it's within a hierarchy of parent being an authority figure and having thus more control and power in this relationship. Acts of anger can be extremely empowering to a certain degree. Anger in many cases is the most accessible emotion that a child anchors other more unbearable and complex feelings onto. So while it might be difficult for the child to openly admit feelings of intense fear and anxiety, helplessness, which commonly are seen as signs of weakness in our society, anger appears as an accessible option to disguise or chain these more complex, sensitive feelings behind. However, if the parent is focused on only fixing the issue of anger and removing it, they might lose the single thread that could lead them to getting a picture of what is hiding and being carried by the child underneath all this frustration. So let's move on to the question now of how to and how much to respond to an emotion. When we think of responding, we might be imagining a very active reaction and behavior. But a lot of response, first and foremost, just deals with listening and learning to listen in new ways, taking the stance of a curious, attentive listener and observer, being present to receive both direct what is directly said and indirectly expressed by the child. And one of the ways that we can think of this is through the idea of what is called the holding environment. The holding environment is a concept proposed by a British psychoanalyst and pediatrician called Donald Winnicott. And I'm going to build on this in more depth, but in relation to how we can use this as a concept of building a language that will affirm and contain feelings of the child. I think one of the pictures that we can compare it to is of a nest, and our attempt to take this posture, which is a mindful posture, and creating and cultivating an intentional space, just as a bird might twig by twig build a nest that can hold the eggs. So the holding environment refers to the physical and emotional holding of a child's experiences without trying to fix or solve these difficulties. Holding the child's discomfort for long enough until they are ready to either regulate themselves or to seek the parents or an external help in regulating these difficult feelings. So I don't know if it's a good example, but it's kind of like taking the child's difficult feelings on rent from them, not changing them, not twisting them, but maybe digesting them, but most importantly, just holding them as they are until the child can take them back from you. So if you were to think of a crisis situation, a common expression that we hear is, don't just sit there, do something. But when we're trying to create and cultivate a holding environment, we have to do quite the opposite. So it would be, don't just do something, sit there, hold what I am handing to you. And that's the essence of what validation looks like. You have to observe something before you can respond to it. You have to be attuned and attentive to what the person is asking for or trying to ask for. So there might be a great deal of expectation of patience from the parent in this situation, which might even require them to put their own immediate needs aside, or giving them to be held by someone else, whether that is your partner, extended support network, or relying on your community network, so that you can make more room for what your child is handing on to you. You have to be, you cannot, you have to, this is, I'll get to this towards the end of my presentation, but I think this is a good moment to reiterate that self-regulation, which is self-care, is essential and a prerequisite for being able to be a reliable grown-up that that your child can depend on. So when the child has emotions leaking through them that they're not able to carry and they hand it to you, you don't have to shift or do anything. You just have to hold it and say, maybe you can even validate and say that, look what I am holding for you. This is a lot of anger that you have. I can see that you're scared. When you want to talk about it, I am here. This is what affirming a feeling and giving validation sounds like. Another factor I think that needs addressing within the holding environment or just any conversation of a family that talks about feelings is developing the capacity to tolerate failure. And if you were to think about a situation where we have worked towards something, invested time and effort towards reaching a certain goal, the experience of watching it fall through and crumble apart can be extremely devastating, but not so much when we think of it in the context of play. So if you're able to visualize a little toddler playing with blocks, building a tower, putting one block over the other, you'll notice that the baby takes as much and maybe even more joy in watching the tower fall down. It's not such a permanent and a scary feeling, and the baby is able to pick up the blocks and build the same tower again and again and again, and learn and grow through these repeated and playful attempts. But as we get older, creativity and play begin to be viewed mostly only through the lens of being the best at it, or competition and success. Any misstep or minor failure on track to that goal is considered very final and almost unacceptable, which makes taking even the initial few steps towards it much more daunting. You're more scared by the threat of encountering failures on the way that you are excited about. I'm sorry, you're much more um, you're much more scared at the threat of encountering failures on the way than you're able to be excited about possibly making it to the end. And I think this picture particularly is a great metaphor for how an environment can create more room for feeling as part of the process of learning and growing. Having expectations and holding fantasies of success for the child, believing that your child can make certain achievements possible, is essential and important for the child's self-esteem. Knowing that someone can see me achieving these things makes them realize that they have it in them to do it. But it should not have to be at the cost of losing value in their eyes or having the foundation of security and safety in the family. Even the most experienced climbers, as you can see in this picture, are able to make risky and thrilling maneuvers in climbing a boulder only when they know that the ones cheering them on are also carefully watching over them from a distance. Someone is spotting for her, and if she were to fall, she can make a safe landing and do it again. And the same goes for parents. Small failures are, as Sam said in his talk right now, small failures for both the child as well as for the parent are inevitable in growing. And not only inevitable, I would say essential in parenting as well. When a child knows that not every single need of theirs will be fulfilled instantly, they're able to bear ordinary amounts of frustration, which aids in their emotional and cognitive development. Finally, I want to talk about what I had addressed earlier, which is self-regulation, which further paves the way for co-regulation of the child's emotions. Self-regulation essentially means taking care of yourself, taking care of your emotional needs as a parent, putting on your own seat belts, and whatever self-care might look like for you, taking a day off from work, reaching out and relying more heavily on your partner, your extended support network, and perhaps even being open about these needs or breaks with your child, depending on their age and ability to make sense of that. Not underestimating their maturity, because children are very intelligent and observant and they can see what you're saying. And if it is dealt with denial, sometimes it can make the child feel betrayed and very confused. So making age appropriate revelations to the child that, okay, I need to take a break right now, but this is temporary. I'm going to get back to it. And when you do that, the child is able to imitate that behavior. You're a mirror to the child, and maybe the child too will be able to see themselves asking for what they need more clearly. So the child might not feel the need to have to make up an excuse about a stomach ache why they don't want to go to school, and instead honestly say that I am very, very nervous about this test. So yeah, the parent has to take care of themselves so that they can be an available and continuous present in their child's life and someone that the child can depend on. So I am going to stop right there. But before I close the discussion, there's this quote that I want to read from this book called Love and Rage by Nupur Dhingra Paiva. And a lot of what I've discussed today is actually structured based on her book. So I would recommend it to anyone interested in child psychology or just understanding the psyche of children in general. So this quote is by William Martin from his book, The Parent's Tao. Do not ask your children to strive for extraordinary lives. Such striving may seem admirable, but it is the way of foolishness. Help them instead to find the wonder and the marvel of an ordinary life. Show them the joy of tasting tomatoes, apples, and pears. Show them how to cry when pets and people die. Show them the infinite pleasure in the touch of a hand, and make the ordinary come alive for them. The extraordinary will take care of itself. Yeah, I think
First of
that.
all, I would like to thank you, Ms. Fuller, for such an informative session. And the quote you shared in the end had such a beautiful meaning to it. So, I'm sure you have made this session, this topic more interesting that we could have expected it to be. So, I think now we'll jump into the Q&A session. So the first question that I have for you is that, there's usually a gap between the achievements of a child and the expectation of the parent. So how would you like to address this gap?
Again, since this talk is essentially aimed at the parents, I would say that there's a difference between having expectations for the child and having expectations of the child for something you want. So having expectations for the child might be you visualizing um, better circumstances, achievement based on the child's potential, and keeping their pace in mind. But when we have expectations of the child, which are for ourselves in some way, that might have to do something with wanting to let the child have a life or have something that we were not able to get. And while that might be coming from a good place of giving the child what we were deprived of, it has to do with a need that is not fulfilled in the parent. And perhaps the parent needs to work through those feelings on their own, whether that means introspecting about it, being able to sort that out, or seeking professional help and dealing with their own needs as a child that their parents perhaps neglected or were not able to address. So I think that is where expectations and um, fantasies of having the child be something that you couldn't be would differ.
Thank you so much, Ms. Pilla, for answering that question. So the next question that I have is basically related to the Indian parenting system. That how the Indian parenting system is so traditional, where the children are on the back seat and the parents are the drivers. So according to you, as a psychologist, what changes would you like to bring to the system without disturbing its uniqueness?
That's a difficult question for me to answer because I am also my mother's daughter, and it's hard to do that because that's a friction that all of us face when there's a generation gap. But um, while the changes, while we have moved on greatly in terms of what the relationship dynamic looks like, and children are more and more adept at dealing with things like, say, technology, we are far ahead of many parents in certain matters, and in some things we are far behind. So this kind of unsettles that hierarchy to a great extent. But I think what I have really emphasized across this presentation, which is things like listening and being a reliable, secure presence, is something that is so basic to any and all forms of strategies of parenting that you might apply. And across whatever the relationship dynamic might look like, feelings of need, wanting safety, wanting more distance or wanting more closeness, needing a hug. Um, they're all very universal needs. And when a parent is able to be attuned to that, no matter how much of love and attention is more common in a more collectivist society like ours, being able to then recognize, okay, maybe they need more space. So just listening to what your child is really trying to tell you, no matter where you are, is the answer to that, I think.
I couldn't agree to you more. So the next question we have is basically what most of the parents want to know. That as a parent, what could be the earliest sign of disruption of the mental health with the child?
Disruption of mental health. Um, I think children do give a lot of signs, and they even, I think this earliest sign, it really depends on the situation and the kind of issue that the child is having. And there's so many forms of mental health. There's issues related to mood, there's issues related to what we call conduct disorders, but they have a lot to do with what society considers that the child must admit. But I really think there's no go-to answer for this one. Or at least I am not able to think of it off my head right off the bat right now. But the earliest sign is best understood when you actually just believe what the child says. So even though when I said that when a child is trying to communicate, say, anger, you have to have an openness to believe that something else is held behind this. You have to have an openness to understand that there's more behind this. But that doesn't mean that you need to do detective work. That, okay, she's angry at me. That's not what it is. Let me figure out what this is and let her know. But that's not the stance that has to be there. It just has to be an openness to listening that there will be more. And at the same time, when children tell you something, you have to believe it. So while you have to have an openness to more possibilities, believing the child when they tell you something. So I think children, if you are open and available, you will know when the earliest sign comes because your child will tell you. Unless, of course, there is other kinds of issues that are in the way, both developmental or even sources that threaten safety within the family environment, like if the child is experiencing a certain kind of trauma, they might not be able to talk about these feelings more openly. So like I said, just maintaining an open stance and you will know when the sign comes.
Thank you, Ms. Kalla, for answering the question. So here's a question by Sahana in the chat box that parents often put their children on a pedestal. How do we deal with it? The pressure by the parents. How can we deal with that pressure?
How can we deal with that pressure? So in an ideal situation, you should be able to have a space that you can communicate this to the parents and let yourself fail. But a lot of that really depends on the parents' motivation and willingness to allow that to happen. But I think now the space that we live in, there's so much access to getting help and care. And when your parents are not someone who are ready to hold on to these feelings for you, you might have to find somewhere else and find someone else to hold it for you, whether that is a friend, an external support, or a mental health professional, until you can hold it all onto it yourself. But I think even in this case, it just has to be an appeal to the parents to be okay with their own sense of failure, their own sense of perfection that they deal with. It must be an exhaustive place for the parent also to be when they are not ready to accept failures from their children. So I think that's a sign that the parent has a lot of emotional work to go through. But I would just ask the child to reach out for whatever kind of mental health support that they can seek, and listen to voices besides their own parents, I think.
Thank you, Ms. Fuller. So, first of all, thank you for answering all the questions. Here's the last question for you. That sometimes children are not able to share with their parents about the mental health issues they're going through, but still, if the parents feel that the child is not in a positive mental state. So, what strategies can be used by the parents to support the child experiencing a mental health issue?
Can you repeat the first part of the question, that when the child is not able to express what they're going through?
Yeah, actually, I was just saying that, sometimes children are not really comfortable opening up to their parents, but still, if the parent has a feeling that the child is not in a positive state of mental health issue, so I'm in a state of mental health. So, what strategies can be used by the parents to support the child at that time?
I think in this situation, it would have to be the strategy of waiting and being patient in waiting for the child to trust you and consider you a reliable support. Maybe the child just wants some distance and needs some distance from you. If that is what they need, you will have to bear that role of being someone that your child doesn't want to be around in this moment. But as I said, needing distance can also be asking for space to work through something difficult. So you will have to allow them the right to work through what they are dealing with, and and remind them that you are there when they are ready to talk about it. So waiting for them to take your help, waiting for them to need your help, and if not, I think just the fact that they know someone's presence is there is enough. For sometimes that's all that they need in a moment like that.
Thank you, Ms. Killer, for answering all the questions. Again, thank you for the whole informative session. It was really interesting to hear you out today. Thank you.
Thanks, and I'm sorry about the mini hiccups that happened through it. I was really trying to stay within time, but it was really exciting talking about these things. So
That was really nice, Ikroop, and thank you, Adya. Ikroop, I'm going to just, ask one last question which just popped up, uh, and I'm going to repeat it really. How do you prevent children from hiding things from parents? Right? I'm just going to repeat the question because it's just so important for parents. Students, sorry, children do tend to hide things, right? We all know that. We've done it when we were children. But as a psychologist, what do you feel? How can, we make things better?
I think there's more than, first of all, that's a very important question. We continue to hide our feelings through childhood and as we grow up, but there can be more than one reason for that. And sometimes that reason can be for protecting themselves, either protecting themselves from facing this emotion that is too difficult to bear. As I said, when we access more available emotions like anger, for example, in some moments, it's perhaps because feelings of um, worthlessness, helplessness, things that we can't control and change. Anger is something that you can play with, it's something that can create change. Feelings like hopelessness lead to a sense of stuckness. And coming to terms with that is a devastating feeling. It So sometimes we might hide it because it's too anxiety provoking to let it into consciousness. And we can't stop children from hiding things, but we can create a space where we are constantly reminding that there is a space if and when you need to make this available. And as far as protection of your own self is concerned, we also hide feelings sometimes because we grow up in spaces of unsafety. So it's very common for children to go through experiences of early traumatic experiences, abuse, and expressing any kind of emotion sometimes can lead to a threatening experience. So a child might be doing that as an act of taking care of themselves, and the parent might have to be attuned to that and respect when they do that, respect that they are hiding this. So, but of course, waiting for them to share it with you, I think. So, yeah. I think you're muted. I can't hear you.
I was, sorry. Yeah, thanks. And I think it's important for parents to recognize those early signs so that they are engaged from the start. So it's not just about this child hiding, but also the parent being a little more aware and attentive. You know, so thanks a ton, and we've got Dr. Parik in now. So I'm just, we should. Bring him on board. And thanks again, Ikroop, Dr. Parik. Welcome. And over to you, Sarah.
Next, we have Dr. Sameer Parekh, a psychiatrist as well as director of the Fortis National Mental Health Program. He is a well-known author and has been a speaker on national and international platforms. Dr. Parekh also has a very prominent presence in the media. He has played a key role in enhancing the image of mental health. He is amongst the most well-known experts in the country on mental health issues. For our panel discussion today, Dr. Parekh will be talking about evidence-based mental health support, what works and how do we know it does. Dr. Parekh, if you could lead us from here.
Thank you. Thank you. Now I was thinking about this topic that you had, and I'll tell you my first honest reaction to it was, why is the need to discuss it? And the thought came to my mind primarily because what are the odds of this being a cardiac conference? And one is talking about the efficacy of, let's say, stents. Yes, one can discuss the efficacy and the evidence of a newer stent or something like that. So when most healthcare conversations happen, or most health related conversations happen, the fact that we need to ask what is evidence based and what is effective or not ideally should be a given. That when we talk about something, whether it's from therapy's point of view, whether it's a CBT or a DBT, or whether it is medications, or whether it is electroconvulsive therapy, or whether it is any other form of treatment that has been there in the field of mental health. But a lot of times these questions keep coming and keep coming. And I think we should first ask ourselves why the question comes. Second, ask ourselves what can we do about it. And third, the obvious, is there evidence to it? So let's understand this. Go before 50s, 1950s. You did not have any medications which were there for psychiatric problems. You had psychiatric disorders. You knew there is a problem. You could even identify, but you didn't know what to do with it. When initially medications came in, they obviously had a lot many more side effects as compared to also the obvious effect, chlorpromazine being amongst the first ones, where you were able to see an improvement in psychosis, but they would also give a lot of sedation, that vegetative like feeling that you would feel that if a person takes it, there will be a lot of sedation, you will not be able to lead normal life. From there, things moved forward. In between, electroconvulsive therapy came, and a lot of aspects of electroconvulsive therapy today that people still think that it's an inhuman form of treatment, don't realize that it happens under general anesthesia, and it happens along with muscle relaxants being given. So it's like a short procedure about which the patient wouldn't know. But the thought around ECT comes by what one has seen in media. And the second thing is, ECT was identified before muscle relaxants came. So there was a period in time where, yes, those, those rigorous fits because of the ECT did take place. And then when you move forward, you started having these other medications. Then the SSRIs finally came. And then finally, you had a designer medication, so on and so forth. And as we stand today, you have evidence about most psychiatric disorders having an excellent response to modern day treatment. Most people, even if you look at, let's say, something like schizophrenia, you are well aware of the fact that 60% of people would lead an absolutely normal life. 20% would still have some symptoms. It's only 20% or so where there is going to be a concern. Now, I gave the example of schizophrenia primarily because of the way we look at the illness. And obviously, when you look at other illnesses, the treatment, the efficacy of treatment is a lot more there. Similarly, when you look at the entire aspect of psychotherapy from the earlier analytical Freudian, where one theory came, then, it was readjusted, rejected by a few people, then a new theory came because it was an evolving science. Take the example of COVID. In the last 1 year, how many times we have changed what medication works? We started with one, then the guideline came, no, not effective, then had something else, not effective. Why? Because it's an evolving science. As you know more, you learn more, you implement more. The same happened when therapy also became a part. And then as you moved forward with more clarification on diagnosis came, what that did was personal discretion, personal opinion about what a person may call an illness, that changed drastically. So today, when you look at what is diagnosis, there has to be very clear impairment in functioning. If impairment in function is not there, it can't be a disorder. There is a structure to diagnosis. What it does is it prevents unnecessary personal discretion and subjective aspect of diagnosis. whether you follow the ICD-10 or ICD-11, sorry, or DSM-5, you would be able to reach wherever you are in the world with almost a similar diagnosis. So diagnosis became standardized, which was very important. Similarly, treatment got standardized. So today, if I speak as a psychiatrist, let's say if I see a patient of major depressive disorder, and be very clear, depression is the single largest illness in the world. WHO says 300 million people globally suffer from depression. So let's not have a conversation and even allow conversation about is it an illness, or is it overdiagnosis, or is it underdiagnosis. It is the single largest illness. Overdiagnosis is not a problem in psychiatry worldwide or mental health worldwide. Underdiagnosis is, because lesser people than who require help seek help. And that happens because of the nature of conversations that happen in mental health. So quackism in mental health is a concern. Because anybody can write anything. And in today's ever-prevalent, ever-intrusive, unhindered digital space, anybody can say anything that they want, that they wish. So if I have thyroid, and if I am taking a medication, but I also think that by taking some other, by doing something else, my thyroid is better, and I start writing about it, how many people will say that stop your thyroid medicine and do only what you think has worked for you? We won't say that. But the moment it starts coming in the field of psychology, psychiatry, mental health, all of these things start trickling in. So understand the history. We're still looking at just about 60, 70 years. And that's why one needs to keep understanding that it's a conversation which is an issue. Now, whether it is the portrayal in media, whether it is the conversation in social media nowadays, whether it is the quackism, which basically is people who proclaim to be expert are not experts and keep giving advice. And a lot of people are not able to filter between the credible advice and advice which is not coming from a credible source. So the question should be, how do you identify credibility? How do you know the information reaching out to you is credible or not? There is science will keep on evolving. If you look at DSM-3, DSM-4, DSM-5 now, diagnosis also evolved because science can't be rigid. If it will become rigid, then it's not science. You keep evolving, you keep learning. So yes, the medication which was used in 50s for psychosis is hardly used now. Yes, ECTs which were used a lot earlier with the advent of newer medications are hardly used. So why that happened is because constantly science evolved with evidence that was there. So how do you decide on what to do? Let's say a patient of depression comes to you. You may be a therapist, you may be a psychiatrist, you may be a general physician. How do you decide? The evidence is very clear. You first reach your diagnosis, rule out the comorbidities, see the severity, mild to moderate. You decide that you give therapy, and based on the symptoms, you may also decide on medications. Moderate onwards medications is a must. In severe cases with suicidal ideation, look at what other medications can be given. That's one. Then let's say if I'm as a psychiatrist treating somebody with medications, I am very clearly aware with evidence what is my level 1 of medication. If that doesn't work, what is my add-on? What is the adjuvant? How do I decide? So do I look at the diagnosis, which is incorrect? Do I look at an add-on medication? Do I change the medication? What are the levels? And what all I can give and I can't give? That is very well defined. What happens is that we keep on getting also a lot of people who also end up talking about what they believe. And since it is psychology, a lot many more people consider themselves to be experts. I wish there were so many experts in the world. I mean, India has a shortage of over 500 experts in the field. So if all those proclaiming to be experts, if they were actually experts, it would have been an absolutely wonderful thing for the branch and for the country, world, and the quality of life. So that's why this topic becomes important. Even though it's a given that therapeutic intervention, biological or psychosocial, are very well evidence-based worldwide. But A, there is still a lot of quackism happening which needs to be addressed. And B, a lot of times like other branches also, experts of the field, rather than following evidence-based treatments, start doing their own versions of it, which is where a concern lies. I think it is ethical, and a lot of you are young people, students. Keep your ethics always with you. If your ethics are going to be with you, you will be on the right side of science. Ethically, you stick to evidence-based treatments. For example, DBT is effective in borderline personality disorder. Robust evidence, studies have happened, double-blind studies have happened, observer variant studies have happened. There is data that is out there. Read more research, read more articles, because you'll keep upgrading your own knowledge. See how treatment paradigms are being decided and how they are happening. So treatment needs to be decided on research, not only on clinical experience. Clinical experience needs to follow the standardized processes where it could be repeated with all other variables taken care of. And yes, if it is evidence-based, that yes, this experience of yours can be replicated across the board at various aspects, then why not? That is a new learning for the science. That's the way you understand it. So treatment protocols are standardized, they are reliable, they're replicable. That's why it becomes evidence-based. It's based on research, not only based on clinical experience. There are well-defined algorithms for most treatments. That, okay, this is step one. So for example, if I give an antidepressant, when do I review again? I know it will take about 10, 14, maybe 3 weeks based on what salt I have used. So my review would be accordingly. And I know that if there is a psychosocial stressor, then what form of therapy would be done by a therapist? Or let's say if somebody is having trauma, then what kind of therapy works? All of the various kinds of therapies have their own place. And so what happens is, now look at the other side, which is quackism. Let's say you are a person who studied a particular kind of therapy only. And just for an example, I'm saying, because it comes to my mind straight away, let's say hypnosis. Now, that does not mean that you have the luxury, the liberty to start using hypnosis wherever you want. Because if there is no evidence of treatment of depression, in treatment of depression of hypnosis, you can't be using it. You may be an expert, but you need to pick and choose where you apply that particular style of therapy. Now, once you stop doing that, that's when the concern happens. That's the ethical dilemma. That's what hurts the field by and large, because we lose base with evidence. So if you're doing CBT, for example, and you decide that, oh, in my style of CBT, this variant works. Now you start applying that across the board, irrespective of the diagnosis, or relaxation guided imagery, for example. And now take the same example in medication. Would all cardiologists give the same blood pressure medicine to all people for blood pressure? No. They would pick and choose the molecule based on so many other factors. Similarly, psychiatrists, neurophysicians, general physicians would be using the same aspect, various algorithms that are there, which have been proven for time that this is how it is. And also understand, as we move forward in life with insurance sector coming in, and I hope it comes in sooner and more effectively and is applicable for OPD and for therapy, you will need to stick to more and more evidence-based work. And this is what one needs to understand. Of course, there are limitations to research. That's why you have more research. That's why I mentioned it's an evolving science, like any science is evolving. But just because you have research which keeps on happening and bringing newer light, that does not mean you question in terms of, you question what is there, but you don't reject what is there. You don't say this may not be effective and claim something else being effective, which is not even tested. And that's something we all need to understand. And that's why I feel ethics need to be on track. You need to be clear, sure about your own branch, your own approach, the seriousness and the responsibility that should be there for you to be able to function in your role. And that's what is the need of the hour. The need of the hour is all mental health experts should be a part of all possible conversations happening in mental health around their space, so that they are there to rectify all myths that come and hurt the entire perception of the branch. More importantly, that reduce help-seeking behavior, which is abysmally low worldwide. Stigma, lack of help-seeking, judgmentalism, and the boundaries. All of these need to be done. I'll ask you, I'll share a couple of questions. I've been taking these, various forms of courses and internships for very young students also. And you'll get a student who says, why can't I do a therapeutic session in a cafe in front of 50 people in the middle seat? How is that even possible? What boundaries are we talking about? Now, you just can't say I saw it in a film, or I tried it with 2 people, it worked well, so now I can do it. No, there's no evidence to it. The structure to therapy has its own rationale. You can't take a walk in the park in the name of psychotherapy. So these aspects need to be understood. No boundaries, algorithms, research, the fact that there is a science and science will evolve, that understanding needs to be had. So coming back to our topic, a lot of times this topic would have never happened. In most branches, this would have never happened, but it's happening because there's a reality that there is both quackism, personal discretion, subjective expressions that a lot of times take precedence or more space than the evidence, which is clearly about the efficacy. And the efficacy of most treatments for most illnesses are very, very significant, undoubted significant. And that's why we do harm when we question something which is efficacious, because hundreds of people who could have been helped are not helped. So responsibility, not just empathy and compassion, responsibility is something that needs to be there when we start talking, when we talk about psychotherapy, psychology, mental health, psychiatry, and the branch. On that note, I shall start taking questions if there are any.
Thank you, Dr. Samir, for a very detailed and informative session. Much needed talk for all of us. We do have a few questions from the audience, so without any further delay, let's head right to the Q&A session. Are there any sources from which evidence can be gathered so that we can back up mental health?
Read, young people, read. What do you mean? Is there any source? There are hundreds of sources. There are journals which are there. There are textbooks which are there. Right? It's very important to understand this. In fact, I believe that more and more academic conferences and academic institutes need to have research and research article reading, textbook reading very integral to our educational system. That no student should ask us a question that from where do I read?
Absolutely. How helpful is it for an individual to look into evidences before seeking support for mental well-being?
You're talking about the client here and not the therapist, right?
Yes, sir.
A lot. So ask yourself the question, how many people who would have a hemoglobin low will actually start looking for various aspects of hemoglobin? And all of us know that how many, there can be so many causes. So you'll go to the doctor will say that, yes, in today's internet era, people will be reading a lot more because there is information out there. But a lot of these people would also not be able to distinguish between a credible source and a source which is actually having no credibility to say what they are saying. So I am nobody to tell somebody, or none of us is somebody to tell somebody of their free will and right that they would want to first look at something. Feel free to do that. But ensure that you reach the right resource. That's why media literacy. That's why I said all people in the field should be present in the digital space, talking more and more about the science.
Another question that has come up is, how can we implement evidence-based mental health support in our daily lives?
See, when you talk in terms of support, there are two aspects to this. One would be, which is more lifestyle and how do I incorporate a healthy lifestyle which is good for my mental health? That is one thing. Second would be nature of support. Now, nature of support, if you're asking as a non-psychology expert, it will be a different answer. If you're talking about as a psychology expert, then your answer becomes very different because you have a different hat that you are wearing and a responsibility which comes with very clear boundaries and expectation. That's how you understand. So, and how much evidence would you need to know that good nutrition, good exercise, hydrating well, saying no to substances is good for health? How much evidence would you need that, you know, basic breathing exercises, relaxation, creativity is good for health? I mean, there is robust evidence about how it helps in immunity, how it helps in your overall well-being. I mean, how many countries today even try looking at happiness? We look at having happiness curriculums, loneliness ministers, but we don't look at what we can do, which is out there, which is bringing self-correction, which can actually bring a sense of better quality of life.
Absolutely, sir. We do have a question from the audience, namely Devanshi is asking, Sir, what do you think about online therapy by licensed therapists? Apps like BetterHelp are advertising the same.
Two aspects. I think online therapy is here to stay. I believe online therapy, especially for a country like ours, is something which is important. If online treatment would not have been allowed, especially if I'll say this as a psychiatrist, then in the last 1.5 years, so many patients would have struggled because of the way the lockdowns and all affected our lives. That's one aspect. Secondly, I also feel that online treatment brings a lot more of cost effectiveness to treatment. And why I say this is a person who's coming to see me from the other part of my country might take a day to reach me. 4 or 5 working days of 2 or 3 people accompanying are all lost for one little consult where I'll be asking that individual to come after 3 or 6 months. Now that can be stopped. That's one aspect. I do feel that it is absolutely fine to do online therapy, but I feel that all aspects of boundaries, science, all aspects should be taken care of while we are doing it. Now coming to the aspect of talking about it in the open space. I have a few issues of how it can be said. I think it should be bare minimum following all medical guidelines or ethics that are there for medical doctors. I think they should apply to all form of healthcare practitioners, including psychologists, which means you can tell somebody that you are a therapist and you also do online therapy. That's about it. But you can't go beyond that. I have my own issues about the way sliding scales are being used. Sometimes it creates a lack of transparency, which I've never been comfortable about. There are various aspects, and like I said, we need to evolve, but we need to evolve keeping our ethics with us.
Completely agree with you on that, Dr. Parekh. Really got to know about some insightful and useful information. Wish we could take this discussion further. However, it's now time for our next panel discussion. But nonetheless, thank you so much, Dr. Parekh, for your time and hope to hear from you in the future.
Thank you.
Thank you, Dr. Parekh, and thank you, Sarah. Divyansh,
Yes, ma'am.
we have you in. Great. So please take over from here.
So yeah, it was a indeed a great session by Dr. Parekh. So next we have among us Miss Pratishta Trivedi Mirza, who is a senior clinical psychologist. She is a part of an organization named as Inner R. Pratishta takes an eclectic approach to therapy with the belief that each individual is unique, and accepting this uniqueness, she makes for the most successful therapy experiences for the client as well as the therapist. At NRR, she drives the research efforts to ensure scientific validity and evidence base for all the products and services provided by the organization. Along with taking the therapy sessions and conducting workshops. So Ms. Pratishta will be speaking on the topic identifying mental health issues. So over to you, ma'am. Thank you.
Thank you, Divyansh, for introducing me. I hope I'm audible and visible.
Yes, ma'am.
Right.
should we, because the session is to start at 4, should we wait for some time and give people a little bit of a break to go get some tea, coffee, or should we start? What do you
Ma'am,
suggest?
you have the audience, you can start.
All right. Then let's begin only. Hi everyone, I am Pratishtha. Like Divyansh said, I am a clinical psychologist with Inner Hour, and as a part of Inner Hour, what I do is I take sessions, I take, I hold webinars or workshops like these, and I also drive the research efforts. Uh, and at Inner Hour, we believe that, mental health services should not be something which are a luxury, which people should not compromise with their mental health because they do not have the right help available. So that's what we try to do here. So what I'm talking about today is, recognizing early signs of mental health, doing, some myth busting here, and maybe also talk some of the strategies that can be utilized for, that you can utilize for yourself to feel better. So that's what we would be doing. I'll be more than happy to answer questions. So please send your questions in the Q&A section. Oh, sorry, in the chat section. And yeah, so let me share my screen and begin. Just 1 second. Able to share? I am not being able to share. The only option it's showing me. Now is this visible?
Yes, ma'am.
Yes. All right. So what we are talking about, like I said, is some basic signs and symptoms, and what are the different strategies that we can do. So essentially, basics of mental health awareness. What I want to do, I want to start with, firstly, of course, a disclaimer. I am a mental health professional, and like Dr. Parekh earlier was saying, there is value in, mental health, or mental health professions are based out of science. So there is, a very significant need to make sure everything that we are talking about is valid. And while I'm talking, whatever I'm talking about here is all evidence based strategies, but because these are general things that I am saying, these are not unique to individuals, so they are not, replacements or substitute for any treatment that anyone is seeking at any point. And please, I request everybody consults a qualified and a licensed clinical mental health professional for advice and treatment. So this little disclaimer here. The content, tips and strategies suggested in this webinar, what I'm going to talk about today, are meant to act as general guidelines for overall wellness, to supplement your personal self-improvement efforts and any ongoing previous or planned consultation with a medical slash mental health professional you undertake. The contents are also not intended to substitute and or replace the advice, treatment and or diagnosis of a qualified licensed mental health professional. And please always consult a qualified and licensed clinical professional for advice and treatment of any clinical condition that you might be suffering from. And with that, let's start with some myth busting. Now, since all of you are here, maybe we take the next couple of minutes to talk about these myths, and maybe some of you can send in your thoughts in the chat section about this. This is probably one of the most common things that I have heard, and maybe also believed in the, before I was a mental health professional, maybe in part. So if any of you also believe it, I totally understand. Mental illness is caused by a personal weakness. So what is your thought on this? Is mental illness caused by personal weaknesses, or what is it caused by? Any thoughts? Well, mental illness are definitely not caused by any personal weaknesses. These are biological conditions at time, caused by, an imbalance of neurotransmitters, chemicals in our brain, or they might be caused by, negative experiences. But this is not a reflection of any personal weakness. people with mental illness never get better. Again, one of the things that give mental illness a really bad name. Not true. People with mental illness with the right intervention at the right time, live as normal lives like anyone else. Mental illnesses are incurable and lifelong. Not at all. They are, you have scientifically based, evidence based interventions for mental health concerns. They are not lifelong, whether we talk about severe mental health issues such as schizophrenia, bipolar disorder, or common mental health concerns such as anxiety disorders or depression or stress based concerns. These are all curable with the help of psychotherapeutic techniques, with the help of pharmacotherapy. It is impossible to prevent mental illness. Again, a complete myth. This is not true at all. We can prevent or delay or avoid mental illnesses by doing things which are good for our mental health, and this is something, some of these things we'll be talking about as we move ahead. I can't do anything for a person with mental illness. Now, I do want to say here before I go into a detailed description is that you do not have to take personal responsibility for anybody who seems to be suffering. You can, of course, support them. You can, of course, help them in seeking help, but you do not control what someone else is doing or feeling. Having said that, if you know someone around you, whether that's a friend, that's a family member, that's a classmate or a colleague, you can definitely be there and hear them out. You can help them seek the right resources, find the right resources, or just help them, be a sounding board. With this, I want to get into, the early signs of mental illnesses. Now, what I'll be talking about are early signs for most mental illnesses. Of course, there is a whole variety of mental illnesses, but what I'm talking about early signs which might occur for most of them, right? Mental illnesses are very often not conditions which develop overnight. They gradually, become more and more severe. So they manifest in multiple ways. Let's start with physical signs. And I know it's interesting, or rather almost ironic, that the first list of early signs that for mental illness that we are talking about are physical signs. So a lot of physical signs can manifest because of an underlying mental health concern, such as low energy. So if you have been feeling tired, fatigued, don't feel like, that you have any energy, it could be a sign of an underlying mental health concern. Headaches or different kinds of backs, aches and pains, backache, neck ache, your, joint pain. And of course, I'm saying this if with the disclaimer that you have sought other treatments or other evaluation for these concerns, and there have been no findings. So unexplained headaches, unexplained body aches and pains, nausea, heart problems, stomach difficulties. And stomach difficulties, in my experience, is one of those conditions which if untreated or if undiagnosed in any other manner, is very likely to be a mental health concern, because of two primary reasons. Our body's stress response, the way our body responds to stress, is by triggering a mechanism called the fight or flight mechanism. The fight or flight mechanism includes releasing certain kind of hormones, digestive juices in the stomach, which is good, but the excessive release of those digestive juices, or acid almost, eats up the lining of your stomach. And that happens if somebody is going through chronic stress or chronic anxiety, because the stress response is being triggered so frequently. So then it starts manifesting as indigestion, acid reflux, heartburn. So if you find yourself, or anybody around you, you find yourself complaining of a variety of stomach difficulties, and you've consulted practitioners, you've consulted your doctors, but it's not helping, then also I would suggest to seek mental health, advice with a psychologist or a psychiatrist, and explore any underlying, stressors or things that are making you anxious. In fact, I remember, long back, I started seeing someone who had a mental health concern called OCD, and it's one of the more severe mental health concerns, and very clear signs of it, obsessions or repetitive thoughts about cleanliness and followed by compulsive cleaning behavior. And when I was taking their history, and I said, "Oh, have you ever had anxiety in the past?" Because OCD is an anxiety concern. And she said, "No, I've never had anxiety in the past." And in the flow of history taking, I said, "What about physical health concerns?" She said, "Oh, I've suffered from indigestion for a very long time." I said, "Okay, did you get treatment for it? What was the diagnosis?" She said, "There was no diagnosis. I would suffer from it. I would start taking some, those digestion pills or syrups like Digene or something, and it will be fine for some time, but it will come up again, and nobody could ever find out why that was happening." I said, "Okay." And when we further explored, it turned out that this person who had now developed symptoms of OCD had a very long running history of anxiety, which was manifesting as stomach difficulties. So it's important to be aware of the connect between your physical health and your mental health. The next category of early signs are emotional signs. If you find yourself to have become very irritable, you snap at small things, you're easily frustrated, you might feel overwhelmed very easily, there might be crying episodes, or you may feel on the verge of tears, then that might indicate an underlying mental health condition. If there are mood swings, if you feel like you are sitting on an emotional roller coaster, please seek, a mental health professional's advice or support. You're feeling agitated, snappy, overwhelmed, you're feeling bad about yourself, you have difficulty quietening your mind, it seems like your mind is constantly, running for something or the other. In fact, in addition to, if like I said, if one of the physical signs that I wanted to highlight was stomach difficulties, one of the emotional signs that I want to highlight here is irritability. If you find yourself to have become more irritable than before, I would suggest or urge to take some time to reflect on whether you've been feeling stressed out. Cognitive signs. So cognitive signs means or refers to all things to do with thoughts. So if thoughts and thinking, so if you find you're constantly worrying, that there is constant commentary happening in your head where you're not being able to focus on other things because there is always some chatter which is happening, almost 24/7, or all the time that you are awake, which also results in difficulty in remembering things. A lot of times people come for therapy, and when I'm taking history, they'll say, "Oh, we've become very forgetful," which is strange because, young people have no reason to become forgetful. But what has happened very often is that because people have this constant, flurry of thoughts happening, they're not paying attention, they're not attentive to what's happening in the here and now, and when they're supposed to recall later, they do not remember it because they did not pay attention to it. So it's a lack of attention which is happening, and not so much so as forgetfulness. So inability to focus, forgetfulness are, symptoms that are connected. Then you have negative thoughts. If you find yourself thinking negatively a lot, thinking negatively about yourself, thinking negatively about the future, thinking negatively about the people around you, you seem to be having negative interpretations of all situations, then it is, it's a cause to sort of explore underlying mental health issues. Last but not the least, behavioral signs. If you find your behavior to be changing in any direction. So if you're a person who was generally withdrawn, introverted, and you find yourself to have become suddenly very outgoing, you found yourself to have become suddenly very chatty, or vice versa. If you were a person who was very withdrawn, very outgoing, and now you have suddenly become very withdrawn, you're not interested in things, then this is also a possible sign of a mental health concern. If there has been changes in your appetite and sleep, either it has become more, you are eating more, you're feeling hungry more, as a result you have gained weight, or you have lost a lot of weight without trying to lose weight, without trying to exercise, that's also a sign. Either if you've not been in term, there might be changes in your sleep patterns. So if you've not been able to sleep as well, or you're sleeping excessively, that may also indicate, feeling stressed out. If you feel very anxious or nervous in situations and you end up feeling withdrawn, or you don't wish to interact with people, or you end up avoiding situations or people, then that is also something that you need to pay attention to and sort of reflect on. What are some of the things that you can do to take care of your health and well-being? And I call them home remedies here, because these are things that you can do for your own self. These are things that you don't need to go to a professional for, although, like I said, these are not replacement for professional advice, but these are some things that you can do for your self-care. First is building relationships. Now, there is a study ongoing, I think for more than 80 years now, called the study of human development, or the study of adult development, which is essentially trying to explore what are the various features of life which contribute to life satisfaction, overall well-being. And what they found consistently, because it's going on for 80 years, what they have found consistently is that the single most important factor that contributes to a person's overall level of happiness, overall experience of quality of life, are relationships and the quality of relationships. Which in essence means that if you have good relationships, you're likely to feel happy and satisfied and content. If you do not have good relationships, and if you struggle with interpersonal relationships, then it is going to impact your overall sense of well-being as well. So what can you do to build healthy relationships? Of course, make sure that you're spending time with family and friends. In the past 1.5 years, most of us have been at home, which means, it's possible that you're living with your family, or it's possible that you're living away from your family and friends. So the point is, make conscious effort to stay connected, whether it is with people who you live with, whether it is with people who you don't live with. So make efforts to connect virtually and create rituals which help you bond, which help you value each other. Express yourself honestly and listen attentively. Now, probably one of the more significant things about any relationships is that it involves some form of give and take, right? You give and you get. So anything that builds a relationships would also be a combination of give and take. So if you are expressing yourself honestly and you need, or you want the other person to hear you out, it's also important to listen attentively, right? The same way, if someone is offering you help, it's good to accept that help. And if you need help, it's important to ask for help. And at the same time, it's important to be there for others when they need help or when they ask for help. The fourth point is about setting boundaries and being assertive. A lot of times we end up feeling that if we really love and care for someone, we have to do everything for them, or we have to become a yes person to show our love and concern, which is not true, because sometimes that can become very overwhelming for us, and it can be very intense, and we may not be able to keep up with it. So setting boundaries and being assertive about what you can or cannot do is a very important feature of any healthy relationship. And last but not the least, practicing gratitude, identifying relationships and people that you are grateful for in your life and expressing the same to them is a good way to build healthy relationships. The second set of home remedies is about working on your thoughts. Most importantly, letting go of perfectionism. We all grow up with ideas of ideal things or perfect things, and we are constantly striving for them. But very often we forget that in life things are not as black and white as marks on an exam, right? And it's not that easy to know whether something is good, it can be better, or how much better it can be. But if you're constantly striving for perfectionism, A, we are constantly putting in effort, but B, very, nothing is perfect. And because then when we don't achieve perfectionism, because it's almost unrealistic, we end up feeling bad. We feel like what we are doing on or who we are is not good enough. So give up perfectionism, be flexible with your thoughts. Do not just believe thoughts, your own thoughts also, on face value. Something that comes to your mind, ask yourself, is this a fact, or is this just an opinion that I have, or is this just a feeling that I have right now which is going to pass? What is the evidence that supports these thoughts? Build the right mindset. And by the right mindset here, I mean a growth mindset, which talks about how it's important to see any ability or any experience as being temporary. So knowing that if you're struggling with something right now, or if you're not being able to do something right now, you can always learn and be better. So it helps us take setbacks or struggles in our stride, saying that okay, I'm not very good at this right now, or I'm not the best at this right now. Let me take time, let me put effort, and I can grow and be better. Then we talk about, self care. Now, self care is one of those strategies that no matter how much I talk about, I feel like we can still spend more time on self care. Firstly, and self care is, of course, we usually talk about self care with respect to eating right and exercising and pampering yourself and indulging yourself, which is all good. But here what I'm talking about is self care in the sense of your the way you're thinking, the way you're talking to yourself. So do not be overly self critical. Very often, in fact yesterday I was speaking to someone, and they said, if I am not critical to myself, how am I going to grow? Being accepting of self means you're stopping growth. And we went on to discuss how that is not true, because when we are critical of ourselves, and if we become overly self critical, it is so demotivating that any action that might have been possible for improvement gets interrupted, because we don't feel as well. So it's important to not be very self critical. Accept mistakes as part of life. Accept that it's human to make mistakes. Accept that you are human and others are human, and mistakes are also opportunities to learn and grow from. So do not excessively focus on mistakes, that oh my god, how could I do this, how can I be so silly, how can I be so careless. Do not say these things to yourself. Accept yourself as a whole person. We focus a lot of attention on our strengths and what we are good at, and what we sometimes do by extension is deny or suppress some struggles or some limitations or weaknesses that we might be experiencing, and constantly tell ourselves that that needs to change. Before that changes, we need to accept ourselves, okay, that these are my struggles, these are the things that I need to work on. So we need to accept those aspects of ourselves also. We don't have to hide them. We do not have to deny that we have these struggles. And of course, as a healthy habit, every day do something that you love, whether that is reading, writing, exercising, talking to your friends, taking a nap, you watching funny videos, playing a game. Do that for yourself. Pampering, yes, pampering is what we're talking about here. Indulging is what we're talking about here, within acceptable or reasonable limits. Do something that you love every day. Then we come to expressing yourself. So a lot of times we feel, and again, something that I hear in sessions very often, that people say, I don't want to talk about when I'm feeling low. I do not want to burden other people. Or why am I feeling low? Why can't I just be happy? Why can't I just think positively? Um, yeah, all of us are striving to feel better. All of us are striving to feel happy. But the fact is that negative emotions are as real, are as valid as positive emotions. So there is very little value in suppressing or denying negative emotions. Even if we want to work towards changing how we feel, I will still need to acknowledge my negative emotions. And one of the ways to acknowledge your negative emotions is to accept and express yourself. Talk to someone you trust. Do not keep thoughts, upsetting thoughts, distressing thoughts in your head. Reach out to whoever you trust. Maybe it can be a friend, a classmate, a colleague, somebody in your family, a sibling, a friend, a co-worker. And do not isolate yourself, especially in times that we are living in right now, where so much is happening at an everyday level in the world. It's bound to get to anyone. So if you find yourself to be struggling, please do not isolate yourself. You are not going to be burdening someone else. Rather, you might end up getting a different perspective, which can be very helpful. Maintain a healthy lifestyle. Now, this goes without saying that, our mental health cannot be something that we commit to in brief periods of time. The way we are living our life, the way we are physically treating our body is as important for our mental health as anything else. A healthy mind can not survive very well in an unhealthy body. So we need that. So make sure you're having regular balanced meals. Do not skip meals. Have a regular sleep schedule. When we don't sleep enough, it's not only tiredness or focus that gets hampered. We are we are likely to have difficulties in regulating our mood. So if we have not slept enough, we are likely to be snappy. Our memory gets compromised. So if some of you are students, or a lot of you are students, you might find it difficult to remember what you have studied. It impairs, lack of sleep impairs problem solving and decision making. So for all these reasons, make sure you're getting enough sleep. Make time to exercise regularly, whether it is, I would suggest 25 to 30 minutes of exercise at least 3 times a week, or 20 minutes of exercise at least 5 times a week. It can be anything that you like. It can be going for a walk. It can be, dancing, playing a sport, going to the gym. Avoid smoking, alcohol, and any other drugs, and make sure that you're taking the time to relax and enjoy yourself and do things that make you happy every day. Now, these are some of the things that you know you could do, but there are also some things that you can do to help someone else, and I thought it would be useful to spend 5 minutes talking about that. So express, if you notice someone around you, say, displaying or experiencing the symptoms that we talked about earlier, express your concern. So tell them, I have observed that you've become awfully quiet in the last couple of weeks. Or I'm noticing that you are not, talking to us as much as you used to. Say that you have observed something. If sometimes what happens is, when we ask someone a question that, are you not okay, they may sort of withdraw and say, no, I'm not fine, I'm absolutely fine. But when you express a concern, and adding something that you have observed, that you are being quiet, and you're not eating as much, or you seem tired, you're pointing to something which is evidence. And people may say, oh yes, I'm tired, but because it's some other reason. But still, it's a good starting point. and follow it up with saying that you want to help. Now, again, like I said, you cannot solve everyone's problems, so don't take that, to mean that you're not helping, but help can be in multiple ways. Reassure them that any problem that they're going through is solvable. Not that you as a person can solve it, but that it is solvable. Be patient. Just because you're open to hear, you're open to listen, it is not necessary that someone is open to speak. So be patient, let them feel comfortable. Maybe it will take a couple of days or a couple of conversations for somebody to open up. Be patient. If you cannot do much, you can just start with offering your time to listen. They may not be very comfortable sharing their personal problems, but you can just hang around with them and act as you usually do together. Just because you know that somebody might be going through anxiety or going through depression, you don't have to become a different person around them. You don't have to be like, okay, I will not talk to this person, or I will sort of let them be. You can just do act as you usually do together. If after offering help you realize that they do not want support, don't force it, but you can explore reasons. Maybe they feel that this is not something that can be helped, or they believe that they're very embarrassed about it, or they have tried, or they're already seeking help. So don't force it, but you can go ahead and explore the reasons for them to not seek help. But even if you can't help them directly, you can always offer them practical help. For example, help finish their work, help with, say, study material, help them with practical resources, like help them figure out lunch, help them figure out dinner, help them take breaks, remind them to do something. So these are practical things that you can help them with. Of course, being kind doesn't cost anything. So even if you cannot offer practical help, you can always be kind to someone who's struggling. And of course, in the midst of all of this, do not forget to look after yourself. It's essential, because being around someone who's struggling can be overwhelming. You can anyway have something that bothers you, and because you're supporting someone else, you might feel further compromised. So make sure you're looking after yourself and your emotional health by doing the things that we have just spoken about. Some of the things to avoid saying in such a situation: when you notice that someone is not doing well, just pray about it, for multiple reasons. Uh, Not everybody holds similar religious beliefs, so pointing to that might not be helpful. And secondly, it's not a direct, it's not a specific comment, it's a very generic comment, and may make the other person feel that you're not understanding. You just need to change your attitude. It negates what they're feeling, it sort of blames them for what they're feeling. Stop harping on the negative, just start living. Maybe it's well intentioned that you want them to not focus on the negative things, but I'm sure they're trying. So saying this is not helpful. Everyone feels that way sometimes. While true, when someone is expressing their problems, it's not helpful to shift the attention to what everyone feels or what you are feeling. Just hear what they're saying. You have the same illness as my mom, dad, aunt, uncle, neighbor, colleague, anyone. Again, maybe true, but the time when someone is sharing a concern, it's about them. So let the focus be on them. Yes, we all feel a little crazy now and then. Not helpful, because you're labeling. Crazy is not a word which is interpreted in a positive manner, and you're undermining what they're feeling without intention. What to avoid doing: criticizing, blaming, or raising your voice at them. Do not say that they're not trying enough. Do not say that it's their fault that they're in some kind of stress. Do not at all show any form of hostility towards them. Do not assume things about them or their situation. Ask if you want to understand, do not assume. Do not be sarcastic or make jokes about their condition. It's okay if you do not understand what their condition is. It's better to ask than to, try to undermine the intensity of a problem by making a joke about it. Do not patronize them or say anything condescending. Do not shame or criticize through words or actions. Right? So, key takeaways of this is that mental illness is definitely not a sign of weakness. You can start paying attention to the changes in behavior. Like I said, if you were an outgoing person and if you suddenly start feeling a little, down, you're withdrawn, then that might be an indicator. Do not suppress or deny negative emotions. Express what you're feeling, express what you're thinking to someone who you trust. Keep a healthy lifestyle. Reach out to someone if you see someone else struggling, but be patient. Do not force them to, trust you or talk to you or do the things that you're saying. And do not, like I said, shame or criticize through words or actions. So this is, a little brief on mental health and some signs and strategies. I think we have a few questions, so we can take them.
Yeah, thank you so much, ma'am. It was indeed a great session delivered by you, wherein you first covered all the myths and then talking about the early signs, and then how should we build ourselves strong. So thank you so much. So let's head towards the Q&A session. So the first question that I have is that, you talked about all the signs like irritability, getting frustrated. So if you talk about most of the teens these days, they show these amount of like these signs. So how do we differentiate between whether a person is suffering from mental illness or is just a normal sign, basically?
That's a very important question, Divyansh. That how do we know that any sign of mental illnesses, which are also very everyday experiences, are actually a cause of concern? And you're absolutely right in pointing that out, that most of these signs are everyday experiences. Like sadness is not an illness in itself, or anxiety is not an illness in itself. So I think there are 3 or 4 things that are usually included in diagnosing a concern. I'll focus on one for as individuals as we are experiencing them, is how much of a problem is it creating in your life. So the fact that you are not being able to focus can happen from person to person, day to day. But if your focus has become so compromised that the things that you are required to do in your day, you're not being able to do those things, then that's a cause of concern. Because, if you're a student or if you're an employee, you're not being able to do your, daily thing, then it will create a long-term problem. Also, how long is it going on for? Feeling low once in a while, as a response to a specific thing is okay, is natural. But if you find yourself to be feeling low much after the event is over and still as intensely, then that can be a cause of concern also. So these are the 2 things. Whether it's a diagnosable condition or not, whether a diagnosis is given, is on the professional, but this should be enough for someone to seek help.
Absolutely, ma'am. Thank you. So the next question is like, those teens, or if we talk about anyone who has started to feel the early signs, how should they go about it expressing? Because if we go about expressing it, either the society would neglect us or would discriminate against us. So how should we go and express it out to the people? And what are the further processes or steps for that?
Okay. I mean, ideally, what I would have liked to say is that if people are, the problem here is, at a societal level, us not understanding what mental health concerns are. And so it's not technically the person who's suffering for them to have another responsibility to convince someone else. But the fact is that this is where we are. People do not understand, right? So how do you go about expressing yourself is first you identify someone who you trust, right? It can be a friend, it can be a family member. You do not have to make a public announcement of it. You find someone who you trust and say, this is what I'm going through, this is how it's impacting my life. You can also directly seek professional help. If you do not find it comfortable to talk to anybody around you, and you're an adult, and services available around you, or you can do a quick search of some services available around you, please feel free to do that and seek help. You do not have to go, like, if I'm a professional, nobody needs to come and tell me I have depression or I have anxiety. That's my job to understand. A person just needs to come and tell me what they are experiencing. So if they come and tell me I'm feeling sad all the time, what are the follow-up questions I ask is on me. It's not their responsibility to give me information to help me. It's my responsibility as a professional to ask questions which help me understand their concern.
Okay, ma'am. So the next question that we have is, what are some of the most important steps for parents to do when their child comes up to them and he basically he tells everything that he's facing from. So what is the role of the parents in making him feel comfortable and addressing all the issues that he's facing?
Okay. I want to focus on two things here. Firstly, believe whatever your child is saying. Parents should believe whatever the child is saying. As parents, you may feel this is not a big problem. You may feel that. But the fact that your child is experiencing it is enough information. You do not need to say, oh, this is not a big deal. Do not worry about it. Let them say what they're saying. Second, ask them what they want to do about it. They may not know how to go about it, but they may say, okay, it may help, if we talk to a therapist, or I want to take counseling, or oh, I want to take a little bit of a break from college or school. So ask them, create a safe space where they're able to say these things. Second, do not panic, do not freak out. Oh my God, what is happening with my child? Right now your child, they're coming to you for strength and comfort. So do not panic. Of course you might feel anxious, that you might actually be feeling, oh my God, what's happening to my child? And that's understandable. Parents love and care for their children above and beyond everything. So for you to feel bothered about it is very natural. But do not panic immediately and say, okay, these are the things. Do a little bit of research, find professionals around them and say, this is the person who we are going to reach out to and seek help. Do not blame yourself or the child for the problem which is happening. Once a problem is identified, we need to move forward to the solutions and not necessarily go backward to causes. We have already come a little ahead from that. So when a child is talking, what will help is to have a solution focused approach.
Absolutely, ma'am. Like listening is the key whenever we're addressing a solution. So the next question that I have is that what like a person is suffering from mental health issues, but most of the people who are suffering from it discovers it not at the point when it has started, but lately. So what are the most common reasons why people miss the initial signs of mental health and then they discover it afterwards, like after a span of time?
Yeah, you're absolutely right. People do not realize that they might be having a mental health concern. And most people, on an average, delay help seeking for years, right? The average delay is 2 to 3 years when someone feels convinced that they need to seek help. And there are multiple reasons. First and foremost is lack of awareness. I do not know, like your question was, that is my sadness sadness or is my sadness something more, right? The second is, I don't know that even if it is something more, do I need to do something about it, or this is worth seeking professional help? Because of the myth, the myth that we spoke about earlier, that people interpret it as a sign of weakness. They sort of want to muster through their mental health concerns, saying, I want to do this on my own. People even come to therapy and say, no, you tell me 5 things, I don't want to do
therapy for months, or I don't want to take medication and I want to do this on my own. I'm a very strong person. I have dealt with stressors earlier, and I've heard it many, many times. The point, because people feel that their mental health concern is a reflection of their character strength, they do not want to acknowledge it as an illness, which it genuinely might be. So that's also a reason. And sometimes people don't know कि अच्छा डॉक्टर के पास जाना है, बट कौन से डॉक्टर के पास जाना है, जनरल फिजिशियन के पास जाना है, साइकाइट्रिस्ट के पास जाना है, थेरेपिस्ट के पास जाना है, न्यूरोलॉजिस्ट के पास जाना है, इन सब में फ़र्क क्या है? लाइक people may not know all of these things, right? So it becomes very important. That's why to, you know, there are a few obstacles to mental health services: awareness, stigma, lack of access, affordability. But all of it mostly comes down to awareness. So I think when you start feeling this, it's better to look for information at credible places.
Yes, ma'am. So next question is asked by Anushka Puri, and she's asking that if people tell you that you are stressed or something like that, but you don't really know that what is it, like what you are going through. So how can we find it out?
So I think that's a very important question. So thank you for asking that. If someone is saying that you are stressed, maybe first question is to say, okay, what makes you feel, or what are you observing that makes you think I am stressed? So the person may say, oh, you're being irritable, right? What you can do is start reflecting on when has it started, right? The point is, the question that what is it, you don't need to diagnose yourself. You don't need to say I have anxiety, I have depression. That's not needed. But you can reflect on yourself and say, okay, yes, I do notice that I'm not being able to pay attention in class or pay attention when people are talking. Or yes, I have become less and less interested in my hobbies or things that used to interest me. So ask yourself these basic questions. Try to reflect on, is this interfering in my life in an important manner? And then seek professional help. The professional will help you understand it. You just need to, even if you have this much of information that I know something is happening, right? Which is not something that used to happen, that's enough information. Rest, the professional is going to help you figure out.
So thank you so much, ma'am. It was a great session and a great talk delivered by you. I wish we had more time because, the things that you covered are most frequently asked questions or topics by the teens these days. Because due to the pandemic and all of these stuffs, we are suffering from these kinds of issues somewhere or not. So thank you so much, ma'am. We'll wish to connect with you in future. Thank you, ma'am.
Thank you, Divyansh. Everybody have a great day.
Thank you, Divyansh, and thank you, Pratishta. That was really, that was a lot that you packed in there, and very, very key questions and solutions. So thank you. I also want to
Thank
take
you
this
for having me.
thank everyone who joined in, and especially to the group. Can I have the students switch on their videos, please? The students who actually have made this possible. This is the Ecology Impact Project, and Syed will speak a little bit more about it. But thanks again. Great job, guys. We've got a lot happening tomorrow. Until then, we want to thank the audience. Syed, over to you.
Thank you, Suchita. Yes, absolutely. What a thrilling day. And I think we had folks joining in from 5 or 6 countries. We had speakers from several countries and many of the attendees. I just want to say thank you to all our teams who have done all this work. Thank you for conceiving the idea. Thank you for executing the idea. We have a great day coming up tomorrow. There are a lot of things that we have packed up. I'll quickly go through what they are, but before that, I just want to say thank you to the team. And also, as a part of the impact project that we do at Ecology, some of you may know who are sort of insiders, but you folks, students, you may not know that, sometimes things are messy and things are a little complicated, and it helps you. When I was growing up, and I'm twice as your age, I think, for most of you are half of my age. When I was going to school, things were laid out for me. I had a class, it had a timetable, I had a teacher, my assignments were given to me. I did those assignments. Things were all done for me. I went to a world of education where everything was all done for me, and all I had to go was to consume it. You should not be growing up in that world. You should not be, everything should be laid out for you. And a lot of time, the system that is in and around you makes that mistake. They put everything for you. Just they make things easy for you. It might be good for you. It might be convenient for you for a short term, but it does not prepare you for the world that you're going to grow up. You're going to grow up in a world where it's chaos. It's all very messy and chaotic. And something happens today, and then next day something else happens. So it's a part of our pedagogy at college, and you would notice, and just to give you some example, a lot of things we do it by design, but you do think that it just happened. It doesn't happen. Everything that happens in college, almost everything is by design. So if you recall, some days back, I said, record a 1 minute video and introduce yourself. And you all recorded it and sent it. And then just today before the conference started, we said, no, you are all coming live and introducing yourself. You're not using your videos, or we use your video. And Suchit and I discussed it, and we thought maybe we should send a message out to you a little bit earlier. But we knew you will forget. We know you by now. We know you are not going to take a note of it. It's not going to return on your wall. You would forget. So, and this is how life is. And we focus a lot on life. For maths and English and social sciences, you have your school, and then you go to higher education, and they'll have research for you. But we as colleges are really focused on what kind of life are you going to live, and what kind of life are you going to carve for yourself, and what would happen to the other lives who will come in touch with you. So this is our focus, and it will remain our focus. And I hope that other students who are listening to us, they will get to meet you, they will get to talk to you, and I hope some of the things that you have consciously and unconsciously learned, you will share it with them. So with that, I just want to say thank you again, and I want everybody to look at the team right in front of your screen. These are the folks who brought this conference. We won't be able to do it without them. Um, and tomorrow is a great day, so I just want to quickly go through some of the things that we are going to be talking about. It's a pretty packed day for tomorrow as well. So let's see. So here, we have a school counselor who is going to be talking about. We have a mother who is joining in, a homemaker, so school counselor, and two parents. Then we also have Chandrika Iyer, who is going to be talking about emotional literacy, which is such an important part of any school system. I mean, it's very hard to conceive a school system without emotional literacy. So how can we do that? We're going to talk about that. Curiosity. Um, you are going to be, by the time you grow up 5, 10, 12 years from now, I don't think you will be asked for your resume. People aren't going to ask you for your resume. They'll ask you questions like, what makes you curious? What did you do? When were you last? When were you in the flow? There's a state of flow, that the great book, by the way, called Flow. It's Flow. It's a lovely book. You'll be asked these kind of questions. Again, I grew up, and most of us, all the adults on this side, we grew up in a world where we were asked certain things. We were in a class where there was a teacher, there was a school. You should not be growing up in that way. Your world should be completely different, because you're expected to deliver very different set of things. So curiosity is such an important topic here. And then positive psychology, positive self-talk. This is so important. Talking to yourself, it is such an important thing. And we often find it weird. People notice and say, hey, what are you doing? Are you talking to yourself? Are you crazy? But you study biographies and autobiographies and see some of the greatest work. The people who have done these work, they were involved. They would engage in conversation with themselves. And I read some quote somewhere that said that we are a community of ourselves. We are not alone. We are not just one person. What I was 10 years ago was a different person. What I was uh, 6 years ago was a different person. So I can literally, build a community of myself. I was a different person every 2 years, 3 years, 4 years. And that is more true for you, because your world is changing at much faster pace than our life changed. And this is again a student perspective. This is great. I can't wait for this. We'll have three students or four students who are going to be talking about their own experiences of mental health. And as students are not mental health experts, and you folks are not mental health experts. You haven't seen a lot of work, but whatever you are seeing from wherever you are seeing, what is it? And what do you think are the solutions? For very sort of original perspectives of students. This is again, mental health is not a solo sport. This is, I can't talk more about this. It is so important to build a community of your own and your 3 a.m. friends, as we call them, and then setting boundaries to protect yourself. Again, very key important, very key topic here. Meghna will join us from the UK, and she will talk. And this is a fire chat, a meaningful life as a teenager. As you know, in the session that I was talking about happiness, when you pursue meaning and purpose, something happens inside of you. But what is that? What does it mean? So this session will open it up for you. Santosh will talk about it. And this, I think we're going. This is going to be the last session tomorrow, and this is basically we're going to do exercise. Aisha is going to do some exercises, and she's going to help us understand our body, which directly impacts our mental health. And we'll end with that tomorrow. So with that, thank you so much. I am delighted to close the day today. Thank you, everybody. You have been with us for five hours almost. Thank you. So let's say bye to everybody. Let's wave. I hope everybody's watching us. Thank you so much. Take care.